Mujibul Haq, hi, we can see you. Thank you. We'll be starting in a few minutes. Welcome His Excellency Charles Whiteley to this event. Hi, just give us a few minutes and we'll be starting. Thank you. So good afternoon. I think we'll begin now. I'm Savina Fez Rashid, Dean and Professor at the Bragg James P. Brown School of Public Health at Bragg University. I'd like to welcome all of you. The panelists, those who want to switch on their videos are most welcome to. We don't have the audience on visuals, just our panelists and the speakers. So it's up to you what you'd like to do. I think when we are talking to each panelist, we would request that you share your visuals so people know who you are. There are no certificates to this workshop. It's actually an event to discuss, curriculum redesign. And if there's any further queries, please put in the chat box. If you want to introduce yourselves in the chat box, you can. but we will start with, I'm just going to welcome everybody, as we know that there's been a long kind of mismatch in terms of education and, you know, professional skills development in the sort of health sector, but also in many sectors. We always talk about competency-based learning. We talk about skills development. We talk about teaching and learning. And this project, Erasmus, allowed us to actually work with 2 other universities in the country and 2 other universities in UK and the Netherlands to look at how do you do course redesign, improve competencies and skills. I think in general, this kind of event raises questions around how do we continue the momentum around, you know, skills-based outcomes. What we found from these 3 years was really about how you can work together. Really, it is possible and feasible despite COVID, despite challenges, if there's commitment. This symposium today will demonstrate how 3 universities, you know, we have departments of ICAD, Environment and Health at IUB, you know, we've got AUW, Professor Mullah, and JPG, James P. Ground School of Public Health, working together collaboratively to develop faculty curriculum design and teaching capabilities, faculty and facilitators, really, because not everyone was a faculty, there was teaching fellows involved in general. So really, it's session 1 and 2 is on faculty curriculum design learning. Session 3 and 4 is on faculty teaching capacity development. I will be moderating it. My colleague, Mikhail Islam, learning designer and project design for this project, will be co-moderating with me. You'll hear the least from us, that's the idea, and we want to hear the most from you. I just want to warn you that because, you know, each panel session is limited time, we'd love to hear from everyone, much more, given your considerable experience, your depth of the work you've done, but it doesn't allow us per session, so we're going to keep it as precise as possible, and I'm grateful all of you could join us together. The whole idea of the symposium is kind of to think big. How do we work together? Obviously, there's interest from the 3, you know, universities, the school with these professors in these universities, these departments. But how do we kind of find ways of continue to work together, implement, scale up if we're really committed to this? I'd like to invite, you know, our ambassador and head of the European Union delegation, His Excellency Charles Whiteley, to inaugurate this event and say a few words. Thank you so much for joining us today. We're truly grateful. Thank you.
Thanks so much, Professor Rashid. Can you hear me okay? I've just been having a few technical difficulties.
Yes, we can. Yes, we can.
Great, thanks. Thanks very much indeed. I'm very pleased to be here today at the opening of this virtual national symposium. I think it's a great topic, very interesting topic, and the EU is very proud and pleased to have been supporting it. I think, as you know, our Erasmus Plus program is one of the EU's most successful and iconic programs, probably one of the most people-friendly programs as well. And its projects have a positive image across the world, I think, which helps the European Union in fostering people-to-people ties. And since its launch in 1987, Erasmus has enabled 9 million people to expand their horizons and acquire new knowledge and skills through study, traineeships, apprenticeships, youth exchanges, and other partnerships all over Europe and beyond. So it's not just, of course, about the scholarships, the Erasmus Plus, it's also got an important development dimension, a sustainable development dimension, and it makes a clear contribution to the European Consensus for Development, which stresses in its contents the importance of tertiary education for youth employment and long-lasting development. And we also frame the whole Erasmus program in the context of the Sustainable Development Goals, in particular Goal 4, which aims to ensure inclusive and equitable education and quality education, including tertiary education, and to promote lifelong learning for all. So worldwide and in Bangladesh, as we all know, there's an increasing demand for highly skilled people. I understand from now until 2025, half of all jobs are projected to require high-level qualifications. And as we all know, particularly now in the COVID era, that jobs are becoming more and more flexible and complex and require often advanced digital skills, not least in the public health sector. And people's capacities to think and behave creatively, communicate effectively, and be resilient are more crucial than ever. So turning to the capacity building for higher education, these actions help the modernization, accessibility, and internationalization of higher education in partner countries, as well as boosting quality assurance and governance. And the program creates positive experiences of collaboration and mutual learning among people and institutions from different cultural, social, and economic backgrounds. So we're very pleased that there is that diversity element to it. And we're also happy to note that there's been a growing interest from higher education institutions in Bangladesh in Erasmus+. Between 2015 and 2020, a total of 11 capacity building projects for higher education institutions were selected here. And besides Erasmus Mundus, besides this, Erasmus Mundus awarded around 1,000 scholarships to Bangladeshi nationals since 2001. So we're really pleased about the healthy state of the program. I plan to go on an Erasmus Mundus roadshow around Bangladesh to promote it even further. And I look forward to meeting colleagues and professionals in the higher education sector. I wish you a lot of success with today's symposium, and I hope it will strengthen the basis for continued collaboration and exchange between those European universities from the Netherlands and the UK who are involved, and BRAC University and its partners. I'm really sorry because I can't stay. I have to go and make a call on the State Minister for Disaster Management, but I'll look forward to hearing the outcome. Thank you.
Thank you very much. We'll share a recording of the event with you. And I just want to acknowledge again EU Erasmus funding for this project, acknowledge all my colleagues, Haseen, Salima, project management team at the school, but all the institutional heads and focal people in the Erasmus project. Thank you very much. We'll be meeting all of them as the panel sessions unfold today. Can I get Mikhail Islam to give a quick overview before we go into the question answer with the first panel? Thank you so much, His Excellency. Mikhail, did you want to give an overview and start?
All right, welcome everyone. It is really an honor and privilege. Yes, welcome everyone. It is a real privilege and honor to be here with all of you. It's great to have you with us. Today we've curated our sessions so they are hopefully very concrete and practical in reimagining and strategizing skills-based curriculum and faculty development for student skills outcomes within Bangladesh. So let's get started on our first session, designing skills-based public health curriculum. And we look at and explore how do faculty really design contextualized curriculum that will promote student skill outcomes. Sabina?
Yes, so I'd like to invite the distinguished panelists for this round, Professor Mujibul Haq, he's Associate Dean and Professor at BRAC Business School at BRAC University. Sorry, the font size is so small, I'm struggling. Moinul Islam, Head and Associate Professor of Arts and Social Sciences at Asian University of Women. And then we have Mohammad Hafizur Rahman, Associate Professor and Director of Institute of Quality Assurance at IUB. Can you please join us? And then we'll have a presentation by Ishrat Jahan. Can you please switch on your cameras if possible? Thank you very much.
I don't know why, but I can't open the camera somehow. Any technical issue I'm not aware of.
Okay, so we can still have your picture there, Hafiz Bhai. So that's absolutely fine. No stress. And then we have, we also have Moinul Islam. Is Moinul Islam here? I'm not sure he's been able to join us.
Hasn't been able to join yet. I'm just checking and making sure where he is.
Okay, so maybe we can just start and continue. So Professor Mujibul Haq, just to ask you a couple of questions around, we're looking at diverse higher education in all departments across disciplines. So at least in this first round. So really it's trying to provide a bigger picture from curriculum redesign. What are your thoughts? If you're looking at skill-based curriculum, one, is it critically necessary? And for you, what are the two key challenges to, providing skills-based curricula?
Right. Thank you, Dean Sabina Rashid, and thank you for inviting me to this symposium. Very glad to be with you all. Good morning, good evening, good afternoon, good night, wherever you are. I want to first applaud the organizers of the symposium and the engagement of all the participants, all the partners, individual and institutional. It's a very important issue. And your contributions will not only have impact on the curriculum of the public health programs, but I'm sure that there will be cross-disciplinary, implications and benefits for different programs. So very much appreciate all the partners, sponsors, and all the individual participants. Just let me give you my experience with the most recent curriculum revision I have gone through, and I think that will highlight the major challenges in Bangladesh that we face in terms of designing curriculum.
Could you, sorry, Professor Mujibul, like if you could point out 2 key challenges that would also be helpful to the audience. So
Correct.
thank you for that. I really appreciate it.
Sure. The first one would be, the mindset of the educators. When I say educators, I mean the academic administrators and the faculty members. They have been too slow to change to skill-based curriculum. They have been overly focused and for too long on knowledge-based curriculum. And they have not really, made the shift, gradual shift towards skill-based, competency-based curriculum. So that would be the one. And then the lack of opportunities for our students during their program to apply the theoretical knowledge in the world of practice. That would be the second one. So opportunities like, meaningful internship, undertaking projects which have real life significant relevance, lack of case studies in the local context. We are using in most classrooms, Western textbooks, which do not have much relevance to the local context or the local world of practice. So those are the 2 challenges, the mindset and the, inability or being too slow to change towards a more balanced approach of teaching and learning. And then the lack of resources. And when I say resources, that includes, faculty members, administrators, and learning resources like case studies, local-based research, and things like that.
Thank you so much. That's
Sure.
just really, really helpful because I think you pinpoint some critical issues and very important. I want to go to Dr. Hafizur Bhai, whether he would like to add to this or additional dimensions to what are the challenges around, designing curriculum that is skill-based. Can you share 2 key points or challenges that you feel are critical or add to this dimension? Thank you.
Yeah. Thank you, Professor Sabina Rashid and Professor Haq. I completely agree with Professor Haq also. Anyway, I will give 2 more challenges. The first one will be lack of industry-academia collaboration. Because if you need the skills, if you know where you can put the skills and who really needs it, then the industry-academia collaboration is very, very good. And we don't have this in the developing countries, especially if I tell for Bangladesh, we haven't this type of relationship. First one. And the second was lack of trainers. Because we have a few people, you will see everywhere they are moving in Bangladesh or anywhere. So we need more trainers. So these are the 2 challenges. And I think for this time, this is okay. The 2 challenges I have already told it. Thank you.
That was very interesting and helpful because I think both of you add very critical dimensions to this challenge at a larger perspective. I think I'm not sure if Professor Moinul Bhai is struggling to join us, so I suggest, Mikhail, we proceed looking at solutions. Unless Salima, you have an update. We have an update.
No update as of yet. I would recommend proceeding. I'll request, once more I can join, if you can join then.
I think we just proceed and then it's up to
I
him
agree.
because it's all online. It's very difficult. I apologize to everyone. This is the way we have to proceed. Thank you.
All right, so Dr. Mujibul, some really, really insightful points on really core systemic challenges, I think so succinctly put. So now I want to kind of ask you, what do you think are, what's one solution to these key points about mindset or being too focused on knowledge, context, or looking at how we are following more Western context? If you can just share one similarly concrete solution to some of these challenges.
Thank you, Mikhail. I will request to propose two, all right? So
Great.
picking up on Dr. Hafiz Rahman's point, industry academia collaboration. So what we did, during the curriculum revision process, we invited corporate leaders. We had created a business advisory board. And then we had the Alumni Association of Bragg Business School who came in. We talked to the current students. We obviously, looked at the curriculum of other universities. So this engagement of all the stakeholders in designing the curriculum, that is absolutely critical. And the second one I want to point out and reemphasize, one of the problems I mentioned, local-based learning resources, case studies, local-based, like your discipline, in our discipline, application of knowledge is very important. And during the program, students have to know about the local business environment, local business challenges. So if we can develop local context-based real-life cases, that will be really useful for, skill-based, application-based, competency-based learning. Thank you.
Fantastic, thank you. Those are really, really tangible, specific solutions that I think we all need to think very critically about. Let's turn to Dr. Hafiz. What do you say? What are some other solutions for some of these challenges?
Okay, thank you. So lack of trainers I will listed, and then I will come to Professor Hogg, another point. So you will see we have so many people and they are speaking, but exactly the qualified persons are very few with the broader mindset that they are going to accept this skill-based learning because we are more traditional. And we always teach the students, and the students even don't know that which type of knowledge they are learning and how they can apply in the applied field. There's a very big gap there. So we need really that type of progressive trainers who really know and who really also have experience in the practical field, because some of the people they are very good in teaching, but they don't know about the industrial knowledge or so on. But if the combination of both industry and academic people, or if the people, they can come from the industry or other related field and come to the teaching field, they can provide more support for the students. The first is lack of trainers. And the second one, industry academia collaboration, already Professor Hogg told. Just I will give you one example. I was working in National Health Service UK for 3 years between 2008 and 2011. During my PhD or something from Germany, I knew that whatever I was learning there, where I can apply those type of knowledge. Even from my Dhaka University, I didn't know. So you see, if the students, suppose again another one, the medical students, they know they are very serious in the internship because they know they have to do the same thing after their internship or something. That's why if the industries come forward and they know that they have to take the advantages from the teachings, and they will use those type of students, in their after the graduation or some things, then it will be very good combination. And I think in that case, it will be okay. Thank you for.
Great. I think, wow, I think I've never seen in 10 minutes so well expressed the real core challenges that we faced. I mean, it's taken years of analysis, but I think both of you have really, really captured the essence of what our curriculum challenges are, really, very succinctly. Thank you so much. So I think now we want
Michael?
to, it's
I just wanted to ask, sorry, I'm interrupting. I was just wondering because we only have two panelists because Professor Moinul Hassan has an emergency. Could we ask one more quick question because they talked about, solutions if any of the, if Professor Mujibul and Dr. Hafizu could give one example of what they've done in terms of addressing a curriculum redesign, would it be possible to ask Professor Mujibul and Dr. Hafizu just to share an example, a concrete example for the audience, for us? Is that all right?
Yeah,
Thank
sure.
you.
I'll go first. Sorry, Hafiz Bhai, I'm taking the lead here again. It's good. I mean, there is advantage and disadvantage of going first, All right. So you see, I think that, we need administrators, program directors, associate deans of teaching and learning and academics, right? Who are able to understand and go through the process of curriculum designing and revision. So for example, we have to look at the vision and mission of the program. We have to identify the set of knowledge, skills and abilities that a graduate should have. Then we have to do the course mapping and other learning activities, which will achieve those, intended learning outcomes. And then we have to do that at the program level. So that's the way we went about it, We set the mission and revised the mission and vision of the program, BBA program, MBA program. Then we did, course mapping. We identified the set of skills, knowledge, abilities that the graduates should have. We asked our industry leaders what they want to see, what kind of abilities and skills they want to see in our graduates. And then we designed the courses accordingly. At individual course level, we set intended learning outcome, what skills and what knowledge they should have after they have completed the course, so that when we compile all the learnings during the program in 30, 40 different courses, that will accumulate and fulfill the mission and vision of the program. So that's how we did it. Thank you.
Thank you. Dr. Hafiz, anything to add to that as an example?
Professor Haq has clearly expressed many things, but just I will add one thing with him. That is, we have to change the module or the other subjects in every 3 years at least. Otherwise, we don't know which type of things are coming every time, which type of need we need, which type of subject we should include. And that's why in every 3 years, we should modify the courses or the schedules according to our specific needs. That's it.
Great, thank you so much. I think those real life examples really help to kind of illustrate further how we can start to think about tackling these challenges. So I'd like to turn now to our presentation. I'd like to introduce Ms. Ishrat Jahan. She's a teaching fellow who participated in our Transform project and actually helped redesign a skills-based curriculum that addresses some of these core challenges with some very interesting, innovative learning solutions for curriculum design. Ms. Ishrat, I turn the floor to you.
Hello, thank you, Mikhail Bhai. A very good morning and afternoon to everybody. Thank you to our panelists for the wonderful and succinct discussions. I apologize in advance for not turning on my video. My internet is a little unstable. So if it's okay, I will start sharing my screen.
Great.
Yes. Thank you. I'm actually having a bit of trouble sharing screen. So can somebody else help me with sharing the presentation?
I can take over for that.
Thanks.
Thank you. Sorry about that.
The plan is to open it up for Q&A after the presentation. I think 10 minutes of a Q&A. Thank you.
Thank you so much. So you can go to the next slide. A little bit of introduction. My name is Ishrat Jahan. I work as a research associate at the Bragg James P. Grant School of Public Health, and I was part of the training faculty. I work as a teaching assistant for the anthropology course of our master's program. I would just like to note that we are very sad Farhana Alam couldn't be here with us today. She is the coordinator for our Masters of Public Health program, and she was a core faculty for the anthropology project, for which we underwent the Transform public health training. Let's go on to the next slide. Before we talk about our experience of developing a skills-based curriculum, I just wanted to share a short introduction of the course that we worked on throughout the 1 year of our Erasmus training. So we worked on the anthropology course that is the second course of a 1 year master's program that we have. It is a very short 10-day course, but the aim of the course is to help students understand the various social, political, economic contexts that shape health issues and communities and individuals' experience of health. Even prior to the Erasmus training that we received, we've always tried to immerse students in learning about these anthropological approaches in public health through fieldwork. And we do that mostly through our sister organization, BRAC, who have different projects all across Bangladesh. And through our collaboration with BRAC's health projects, we go into several communities, urban or rural, and help students engage and learn from the community. Let's move on to the next slide. Next slide, thank you. So I think before even understanding how to develop a skills-based curriculum, the question that we worked with was understanding why a skill-based curriculum, and in turn impactful public health professionals needed in the first place. And in the context of public health, that starts with being able to create better outcomes, better health outcomes for the communities that the public health sector works for. And our quest for understanding what skill-based outcomes means for us started with understanding what the community's needs are, what we understand by a community's health context, and the necessity, I think, at this point of connecting our public health education outcomes with the outcomes of a community. And so for us, the starting point was not just the curriculum, and it went to looking for what kinds of skill set is needed if we want to create better impacts for a community. And it is not just about creating, giving a degree to our students. It is about making them impactful professionals who will in the future go and work with projects that have sustainable and impactful outcomes for the communities that we want to help or approach. Next slide, please. So that then led us to questioning, what does a skilled public health professional look like for us? And we based our answers, or at least our set of skills, by looking at what kinds of needs are currently present in the public health sector. What do organizations, NGOs, or public health organizations demand? What kinds of skill sets do they need to create more impactful projects or more create better impacts for the communities that they serve? And also this links with the discussion we just had a few minutes back, that what is the gap in what is being taught in the classroom versus what kinds of skilled workforce we need in the public health sector and beyond the public health sector in order to create more competent health professionals. Because most of the time, what happens is, as somebody who graduates and goes to work, the learning curve of understanding the ground realities that they have to work with is very steep. So I think the overall aim for us in being able to develop a skills-based curriculum was to make that learning curve less steep, enable students to not have to bridge a very big gap from coming out, graduating from an institute and then working, but already be prepared to work with communities and address their problems. And at the end of the day, we come up with specific skill sets that we think we need to address. They can be specific skill sets that are specific to the course we teach. So for example, here, there are particular health technical skills that are present in our anthropology module. And then there are management and soft skills that we teach, or at least we focus on throughout the 1 year. That can be basic presentation skills, how to develop critical thinking abilities, because at the end of the day, one can be a very good researcher, but it is not always the case that we can all develop as good leaders or good managers until we learn these very critical but often not focused on soft skills. You can go to the next slide. Thank you. So these are after a lot of mapping around in our whiteboards, a lot of brainstorming sessions, these were the skill sets that we wanted to base our curriculum development on. So for example, the technical skills for our anthropology course focused on understanding critical gender issues, understanding the need for what community-centric design is and understanding the need for it. And also having students work in teams to develop their own reflective skills or critical thinking skills, etc. You can go to the next slide. So once we had our skill sets and we had decided on them, the next step was to understand then how do we go about designing a curriculum that is effective and that where we can deviate from the traditional model of the one-way teaching, where the teacher just gives series of lectures or blocks of information. In order to do that, we knew that we had to model everything around interactive or engaging methods where students would have to be put in the shoes of the community or in the shoes of the individuals and create or think for themselves and learn how to create that empathetic and critical lens to understand. One thing that really helped us in this process was creating an overall learning narrative for our course, which meant that we had to justify and link what we were teaching each day and how it led to the next day's content. So for example, if we're taking our students to the field to engage and ask questions about a particular health problem, the next day they would come back, reflect on what they had learned from the community, and they would have discussion sessions, debate sessions, and engage with each other and learn through that method rather than just having information given to them. Next slide, please. Sorry for the difficulty. And at the basis of all our design or redesign for this curriculum was the need to create it around the community. Everything that the students learned had to be anchored within the communities that they would work with or engage with during the time of the course. Because if you're trying to develop a set of skills that we want them to have as future professionals to who can enable better community health outcomes, we need them to be able to practice that skill in the real world community to begin with. And that was a very important learning design strategy for us, because they can just go into the community, but if they don't interact, if they don't ask questions, if they don't learn about what the needs, priorities are, then that really doesn't help us develop those skills in them. Next slide, please. But when we do say that we need them to engage with community and learn about needs, priorities, that still sounds really broad. So something that helped us narrow that down and make it more feasible to apply to, for example, this course, which is a 10-day course. It's a short course, but we need them to be able to understand and incorporate the skill sets within them. So what helped us was having a solutions project method where we would divide the students into groups of 6 to 8 people, and throughout the time of the course, they would work as a group. They would be given a particular, real health problem that exists in a low-income community, for example, to work with. They would go into the community, ask questions about the problem, and hear from the individuals about their perceptions of the problem, how they perceive solutions could be, what is the gap between the current services that communities offered versus what they really need or what the community really prioritizes. And then the students would come back and think about those issues critically by themselves, have those solutions that they would prototype validated with their faculties, get feedback from faculty. This enables them to think on their own, develop the skills on their own, and also understand why those skill sets are needed when they would go out into the real world. Next slide. Thank you. So from the overarching solutions approach, then we had to come down into the nitty-gritty of actually redesigning the content that we teach. What are the methods we teach? What skill sets does our facilitators need to be able to teach that? What we did differently for developing a skills-based curriculum was that we mapped backwards from the skills. So we knew that there were particular skill outcomes we wanted our students to achieve, for example, from 2 to 3 sessions. And we would map backwards as to, okay, so what kinds of contents do we need to teach in order to get them to critically engage and practice these skills? what would the methods be in that case? And also, very importantly, what kind of skills would we as facilitators have to have in order to achieve those, in order to help our students achieve those skills? So in the case of designing the nitty-gritty, what we now call a design needs assessment framework was very helpful for us. Next slide, please. I would like to end with a example from the first skills-based curriculum course that we did after the Erasmus project training in 2020. So the thematic topic we gave to one of the groups of students was understanding how maternal health is impacted. What are the factors that impact maternal health in a low-income community? So after a few rounds of fieldwork and talking to community people, the students came up with several iterations of the solution, and based on feedback that they received from faculty, and not just faculties, they took a few iterations of the solutions that they did and went back to the community and asked them, do you think this solution would work for the problems that you helped us identify? And at the end of the day, they came up with a simple solution of rearranging the doctor's room that they had in one particular maternity center. And the solution was very simple. It was just putting sort of veil or barricade between the consulting table for the doctor and the checkup station that the doctor had. I'm sorry if there's any background noise. So the students were working with how there was a lack of father's participation in first-time mother's antenatal care visit, and having that separation meant that having that barricade that separated the checkup station from the consulting table meant that fathers were more comfortable, and also mothers and nurses within the maternity center were more comfortable going to the doctor, being able to support their wives while they were in the doctor's room. And I think what we learned from that is basically if we enable our students to go out and engage with the community and think for themselves, they will be able to learn the skills and incorporate that to actually come up with solutions that are effective for the communities that they will go on to work with. So thank you. I will end there. I'm sorry if I've eaten up some extra time, but thanks again.
Thank you so much, Ms. Ishrath. Quite an impressive curriculum redesign into skills-based curriculum. It's just filled with so many different key, I think, elements that are worth considering. And I really appreciate how you enabled students to go out into these real-world health problems in the community and really come up with some very surprisingly simple but powerful solutions. And I think that's a great message for all of us to take away, that students actually have tremendous capacity to look into these world health problems and come up with creative solutions. So thank you for that. I think this is a great segue into our Q&A with our audience. So I'd like to throw it to our audience for our questions. If you can just raise your hand and then we can take your question.
I would say put it in the chat box, Mikhail, because we can't actually see the audience. So if they could just put in the chat box, then Salima could assist you or me. Are you asking the panelists or you're asking the audience?
No, the audience. If you raise your hand, we'll be able to see you raising your hand. So
Will we?
either way, yes.
You will be, but Mikhail bhai, participants, I mean, the audience won't be able to unmute. And so we can just read the questions.
Oh,
out
I
loud.
see.
Yeah,
All right.
if we could
We
just put
already
in the
have a
chat
question in the
box, yeah?
Q&A box.
Sure.
And then everyone else can sort of follow suit and type their questions up.
Got it.
While
Thank
they
you.
ask the questions, maybe the panelists that would like to comment, Mikhail?
We have a question in the box. Should I read it out?
Yes, please. I don't see it yet.
It's in the Q&A box. It says,
all
thanks
right,
for
I
the
got
nice
it.
presentation. My question is, it is an interesting idea to have student-centric design, but how can we ensure employability after graduation? The job sector in public health is changing rapidly and will perhaps continue to do so. So how can we engage the prospective employers of public health sector to be engaged in designing the curriculum?
All right, Ms. Ishrat, if you could field that question.
I could respond to that, or others could respond to that in the panel who worked in the project. Ishrat, can you respond?
I
Hello?
can respond as well if need be.
Ishrat, can you hear us? I don't know, Ishrat's on mute.
Maybe you should take the first answer. Yeah. Sabina?
Yeah, so I think you raise a very, very important point. I do think that's why I think this event is being held, because the reality, as our distinguished panelists also shared, is that we have to constantly kind of redesign, update, refine content of curricula, because they are changing needs. If you see with COVID now, there's blended learning. If you see with COVID in public health, they're talking about risk communications. They're talking about data management. They're talking about community-based sort of learning. So I think what you're talking about addresses issues about how do you do outreach to other sectors, particularly if you're talking about employability. And one thing I remember talking to Mikhail much earlier on is that, are we talking to private sector? Are we talking to different sectors? But what are the needs for graduates? And I think that's the disconnect. Sometimes education often operates in a silo. I'm not sure if that answers your question, but I think it's a timely question. And what it raises is, how do we do enough of a reach out where the learning and content development and the skills orientation is in alignment with needs in the private sector? And yes, it may keep changing, but it doesn't change day to day. There's some basic skill set. I mean, if I say teamwork, basic professional skills development, basic sort of theoretical knowledge, basic ethos of public health of working in communities is not going to change day to day or year to year. What might change is maybe the approaches or the way you work. Now, a new generation use much more digital. My generation, we were used to in person. So some of that may change, but the principles underlying professional skills and employability is often some of the fundamentals, critical thinking. So I hope that answers one of the questions. And I don't know if anyone else would like to add to that.
Shall I come in on
panelists.
that?
Sure.
So Sabina, this is Linda Waldman. So I thought I'd just come in and say that I think these kinds of activities also require students to take their academic skills and apply it much, much more practically to deal with group dynamics, to deal with the challenges, to deal with deadlines, to work in to me, I think it's much better than an exam. You know, employers never ask students to go and sit in a room and write an exam about what they know. Employers ask students to take what they know and solve a problem. So for me, this is a much better model for thinking about employability, and it teaches students a much wider range of skills than just being able to analyze a problem.
Yeah, if I could just interject also, I think that's one of the key questions that our whole project look to try and constructively address, that employability is at the heart of this challenge. But for employability, we have to look at the context of in this case, the public health sector, what's really needed in the public health sector for our professionals to bring impact. So working backwards and looking at what are the skills that the communities needs that are related to community health needs, and then ensuring that our curriculum become robust in terms of skills curriculum that are relevant for the community. And that has to be dynamically updated all the time. So I think employability is always a part of making things student-centric, because when we look at student centricity, we're actually looking at also what are the skills that students need as future professionals. I hope that answers a bit of the question. Should we move on to the next question?
Yes.
Oh, we have Dr. Mujib would like to also add a point. I think you're on mute.
I totally agree with our Dean Sabina. There are some fundamental skills that are essential, throughout our mankind, and it will be going forward, right? So just to add to critical thinking, problem solving, decision making, analytical abilities, those are things, and for this day and age, change management, crisis management, things like that. But I'm so glad to see that, the team of your team has gone to the field, and they have collected information and data from the, real life, and use those things to revise the curriculum or design the curriculum. So that's a wonderful thing to observe. Thank you.
Thank you. Thank you. So let's move on to our next question. In the chat box.
Michael, if you check the Q&A box, we have 2 more questions.
Yes. So this is from Gwaliwango Marvin. Could you please consider including some aspects of interdisciplinary research and engagement to get students to work with people in other disciplines within the curriculum? I think it would get more people on board to solve the problems with convoluted skill sets and approaches. All right. Who would like to field this? Sabina, do you want to get us started?
Sure. I might as well be of some
I have a
use.
comment.
Yeah, no, I just thought that in at least at the school, we do have interdisciplinary, not as much as we'd like to, but we do. We have, I work with epidemiologists, I work with biostatisticians, and we teach the same course, the Introduction to Public Health. We have practitioners we invite from BRAC who speak. I'm a medical anthropologist by training. We have Malib, our associate dean who's an epidemiologist and a mixed method specialist. We have many different interdisciplinary approaches, but I do agree in research we have that. I think in teaching, it doesn't happen nearly enough as it should. And it's an important point. That's all. I think a holistic approach is critical, and we're trying to do it. And I think it can be strengthened. Absolutely. That would be my response to a very bright group of our audience who are asking some very critical questions. What's the third question, Mikhail?
All right. This is from Farouk Shah. I really appreciate the insights shared. I think curriculum planning should be developed in partnership with employers and other stakeholders. So how does the project address this issue to ensure that training and skills are consistent with development goals of the country as time goes on? So I can maybe take a stab at that. So the idea is that the curriculum and the courses themselves start with the community, as Ms. Ishrat had pointed out. So we start with the community realities, priorities, and context of health. And from there, based on those needs, then we also figure out, well, what is the kind of health professional that's required to competently address those priorities within communities. And so that is how it's linked very much to health development goals within our developing world context. We can ask our panelists also to add a comment, or Ms. Sabina, if you'd like to jump in.
I thought Professor Mujibul Haq, because you're in the business school, or even any of the other panelists, if you want to share, please. No one?
I think this is also a project-related question, so maybe get your perspective on it.
Professor Mullah, maybe Professor. I echo your comments, Mikhail. So I don't really have much to add to it, but I was just wondering if Professor Rabbani or Professor Mullah would like to add anything, given they're part of that. Professor Salimul Haq, who's just joined us, who's in the next panel with us.
No, I really don't have anything to add. Thank you, Dr. Sabina, but I echo what Mikhail said. I think he has summarized what are all our thoughts succinctly. It's fine.
Should we? Mikhail, should we move on to, we have 2 minutes. So if anyone else would like to add anything, I see Professor Mullah here.
There is one more question.
Oh, sorry.
From last one from Selina Amin. Starting from community is not only necessary for the public health program, it should be included in doctors, nurses, midwifery curriculum. Would you or JPG plan to share these recommendations to government? Well, the short answer is yes. If there is interest for us to collaborate on working with government universities on this to train up doctors and nurses, that's kind of the goal of the symposium, to see how we can explore and expand collaboration to those institutions that would be interested in this more skills-intensive curriculum approach. That's a great question, though.
Selina Appa, we were approached by one private sector medical school, and we shared a social science curriculum. But I agree with Mikhail, if there isn't any outreach, it's very difficult. There's no open door for us to go in and impose this on anyone. So if you have ways of facilitating a process for us to share, we're quite open to sharing. I do think our medical curriculum definitely needs it, let alone the nursing curriculum. Mikhail, there's one more comment in the chat box by Ahmed Hussain, but I think that it will be answered in the next session under Rabbani's presentation, Professor Rabbani's.
All right, yes. So if Mr. Hussain, if you could just hold on, we'll take your question after the next presentation. It may actually address or answer it quite directly. So just hold on for a bit as we move to session number 2. So thank you again. This was really quite a remarkable panel in such a short span of time. I think we captured so much of not only challenges, but creative solutions, and even the presentation from the project really hit on some of the ways that we can all consider how skills-based curriculum can really work concretely. It's not just an abstract idea, but it's something that we can really do on the ground and see results for our students' skills, but also to see how faculty become a lot more involved and engaged and fulfilled in this process. So let's move on now to session number 2. Now that we've kind of got the ball rolling strategically on the big picture of curriculum, skill-based curriculum, I'd like to introduce you to session number 2 on innovative health learning methodologies for skill outcomes. So this is really where we look at curriculum, but now look at how do we translate this curriculum into transformative learning experiences to facilitate student skill outcomes. So how do we really get to where the learning experiences are so skills outcome based? All right, Ms. Sabina?
Yeah, so it takes, I have great pleasure in introducing the next round of guests. Thank you so much for the earlier distinguished panelists. We have Professor Salimul Haq, Director of ICAD. We all know him. He's a leader in global climate change work. He set up ICAD. He's known globally, nationally. I'm very grateful, Professor Salimul Bhai. He was very, very active in the Erasmus proposal, joined us immediately, shared similar concerns around curriculum. Thank you for joining us from London, making the time, really grateful. We also have Professor Nazimuddin, who's Associate Professor and of Science and Mathematics at Asian University of Women. I'm sorry, I keep squinting because the font is so small in the writing that I'm struggling, so please bear with me. And then we also have a student, Shamila Parveen, from BRAC JPG MPH class of 2021. They're soon to graduate, so much excitement. They've submitted their thesis. And we also have a professor in transnational ethnography and global health and education, Massachusetts University, Professor Anya Krumik. I hope I pronounced your last name correctly, Anya. Good to see all of you.
Good enough.
Thank you. Okay, how do I pronounce it? Tell me, Anya. What did I say wrong? Krumik.
Krumik.
Okay, so yeah. So I think that we're, you know, as I said that we said in earlier panelists, I wish we had hours to hear from all of you, but we're having to keep the panels quite brief so we can hear everyone's sort of experience and expertise, and then have the presentation and open up for Q&A. So I really want to ask Professor Salimul Haq, given you are one of the leaders in climate change, established a center and known for innovations at ICAD, how important do you think it's for students to be learning outside the classroom when we're looking at issues of climate change? Thank you.
Thank you. Thank you very much, Sabina. Pleasure to be here with you and to have worked with you on the Erasmus project. So I am not a public health expert. I work on climate change, as you said, but climate change now, in my opinion, has become such a big issue that everybody has to know about it and do something about it. And public health professionals who are learning about public health will certainly need to have courses on how climate change is going to affect public health. And you and I have talked about that and have provided inputs to your students. Now, I would say the issue we're talking about, which is learning from experience and on the ground, is equally important in my field in climate change. We run a master's in climate change and development at my university, the Independent University of Bangladesh. And the field of climate change that I work on is on adaptation to climate change. Namely, how can people who are being affected by the impacts know about them and then do something about them? And not from, you know, computer models and sitting in the lab and looking at everything from a very top-down perspective. That's important. That needs to be done. But for the professionals that we are creating, particularly those in Bangladesh, but also in other developing countries, they need a lot more on the ground exposure and understanding with local people who are being affected by the impacts, to understand from the people themselves what they are doing, because people do have a lot of knowledge and experience based on their own experience that our students should learn from. And then the students, together with the people, need to figure out ways forward in terms of what can be done to deal with the problem. And the final point I'll make is that given the current COVID-19 pandemic, the public health connection to climate change has come out very, very strong. You know, most of the communities who have been badly affected by COVID crisis, both the public health crisis as well as the economic associated crisis of lockdowns, etc., happen to be the same vulnerable people to climate change. You know, we used to work with climate vulnerable communities before COVID came, and then we saw the climate vulnerable communities were the ones that got affected. You saw the same in BRAC. And so there is a very strong overlap between helping them on the public health side and at the same time helping them understand initially the climate change problem, because nobody knows it, it's new generally, and then figuring out what to do with about it along with them. So very, very strong emphasis in my view, particularly for professionals learning in developing countries. It's true for everybody, but developing countries in particular, that we need to learn from the people, spend time with the people, and then that is a generally much more effective way of building our own skills as professionals going forward.
Thank you so much. As always, you know, a lot of experience, a lot of expertise, and a lot of insight into how to really have curriculum that is skill-based and not lab-dependent, as our Professor Salimul Haq pointed out. I wanted to turn to the other two panelists, later on to Anya, and I think that, Mikhail, you're asking Anya, right? So I want to ask Professor Nazimuddin, what are our sort of maybe two key challenges in designing skills learning methodologies? I mean, you've been working throughout COVID and doing online learning. So what would you say, what are some of the two key challenges in designing skills learning methodologies?
Thanks,
Thank you.
Dr. Sabina. Yeah, so one of the key challenges I can say is lack of university and community partnership in this country. So, for example, if we consider Western countries and most of the universities, they have a strong social capital between universities and the community, and they're actually at the university, they are responsible to change and to improve and having a good connection. And then also this kind of relationship actually is supporting to the government for policy making. So I think this is one of the key challenges in this country, like lack of community and university partnership. Still, I think there are some universities still working, but I think still it's a very low rate. Generally, if we talk about universities' responsibility is not only just teaching and learning, but also like supporting the society and community. As the previous session also we addressed that. And the next challenge is the urgency, like the realization of different actors. Like COVID-19 taught us already how immediately, urgently we really need to design or to innovate different methods for the benefits of the public health sector. I think that's another is still lacking. I think the realization, the collective realization of different actors like public universities, government, NGO sector. So I think still missing, and we really need to act now. We cannot just talk and then sit down and plan for next 5 and 10 years, and then going so slowly. I think we really need to act now, because we learned lots during this COVID-19 situation, so that we can also tackle for future pandemic situation. Yeah, thanks.
Thank you. I think both Professor Salimul and your comments talk about actually the cross sectors, because climate change and public health actually should be integrated in terms of teaching, learning. You talk about partnerships, which I think is critical to any kind of learning experience, because if we don't have practitioners engaged, how do you learn practice, right? So I think all of you, I mean, both of you highlight very, very important comments. So thank you so much. I'm coming to Shumaila Parveen, student of 2021. So what do you think are the challenges students face with learning methodologies, Shumaila? Thank you.
If I would just specify on some of the challenges from my own experience that we actually faced during this whole, journey of MPH. So some of the problems are, to practically implement what we actually study in the classroom into the practical field when we are going out to work over there. So especially though this whole journey of MPH that was designed, it was more of like, a facilitated kind of teaching method. And then we had a lot of, collaboration and group works and everything that was preparing us to actually implement this all practical aspects of these different methodologies in our group activities, in our assignments, in everything. But when you move to the real world where you have to work in the communities, if you don't have that practical exposure of field works in your classrooms, then it's really hard to actually implement it just by going out there in the first phase. So that's one of the main challenges that I face, like, when you have this practical exposure of field work in this whole journey of MPH, then it actually makes us more comfortable or more prepared to go out there and apply those all methodologies into the context of the communities that we are actually working. And the second challenge I would say is like to grasp those all new kind of approaches or new kind of topics that actually we go through. coming from, especially for the students who are coming from a different discipline of the field. So it's really hard for them to incorporate those all new methodologies that we actually study in the classrooms. So if those are being part of, some of the, as there was one question earlier, like, can we just include some other discipline of studies in these methods so that, those students have some idea about what actually public health approaches or methodologies are. They have some basic understanding. And when they're moving into this program, then they can actually, connect it to what we are actually being taught in the classes. So these are some of just two specific challenges that I would talk about being a student that we actually face in the, when we move out of the classrooms into the practical field.
Okay, thanks, Shamila. So at a basic level, you shared some insights of how you need to have teaching that's beyond the classroom and not just in the classroom for a student's learning. And it might be challenging for a student just to have classroom-based teaching. Is that what you were trying to say, just to clarify?
Yes.
Okay, thank you, Shamila. I think I'm going to go on to Mikhail, who's going to go into the next round with our distinguished panelists. Thank you.
Great. So I think we've set the stage with the context of the challenges we face regarding developing really cutting-edge skills-based learning methodologies for our students. So Dr. Salim Haq, I'll come back to you. You touched on this a bit, but can you share with us maybe what's one concrete solution we can think about in getting this type of methodologies, embedded into all that we learn and teach in the classroom?
Sure. So let me reflect on my own observations, and I'll start from Bangladesh, but these are also generalizable beyond Bangladesh to other developing countries where I also work. The first barrier is our own faculty hardwired way of doing things. Okay, the faculty in most universities that I know teach, they know and they tell the students what they know, and it's an extremely, top-down pedagogic technology, technique and way of doing things, and it's very difficult to make them change. Right? Very difficult. They are the first barrier. You can preach as much as you want to them, but it's not going to be easy. And in that, there's a nuance in there, which is that the older they are, the more difficult it is to get them to change. The younger they are, the easier it is. But the progression from young to old, if they are not incentivized and encouraged to do things differently, then they won't do it. All right. And so that's where I think we are stuck. We are saying things, we all preach this, there's no problem getting people to listen and agree, but it's a huge problem getting them to actually do it once they agree, even after they agree. All right. So we have to really think out of the box in incentivizing this kind of change in behavior. And it has to happen in the universities. It's not external to us, it's us, ourselves. If I can just take a minute to share a paper that we are just publishing together with faculty at the London School of Economics, at the University of Cologne in Germany, at Makerere University in Uganda, and IUB in Bangladesh. We actually delved into what are the barriers for faculty to go and reach out outside their own university and talk to communities, talk to policymakers, engage with them, which takes time and effort and does not get incentivized. The university doesn't care. The university says, what teaching are you doing? What research are you doing? And that's it. If you have made an connection or built up relationship with somebody outside the university does not incentivize you to do that or reward you. And so we'll be publishing that soon. And the idea is to incentivize universities as institutions to invest in making it happen and reward and incentivize younger faculty to do it. Younger faculty are interested, but they're not rewarded. So they'll give up, and they do. And then as they become old, they become, stuck in their ways, and it becomes business as usual for them. They don't want to change. I hope that's useful.
Yes, thank you. That's actually a very, very specific solution that we've all had to kind of get our heads around, that how do we actually align incentives? Because if we expect such a different way of teaching and facilitation, if faculty don't feel that commitment and investment, there is no really way for them to get on board with this. So thank you. I think that's a great, very tangible solution. I'd like to move on to Dr. Nazim. How about you? The challenges you mentioned, what's one solution we can really think about?
Oh, sorry. Thank you, Mikhail bhai. So I think national platforms, number one, I have several solutions anyway. So national platform is really, really important. I think within our project, we have already developed one platform, but if we have national platform with where like consists public, private universities, and also large stakeholders like the actors like NGOs and UN agencies from the practice point of view, and also the government. So only government or only organization or only institution cannot change or cannot actually change the whole mindset. That Professor Salimullah also mentioned, the rewarding, all those kind of, still there are a lot of things missing here. So I think under that platform, we still need to mobilize a collective way, and then we can formulate policy, right? So it's an institution taken like our university, like UW. We are focusing student-centered teaching and learning, like UW. Majority and all of our faculty members, they're actually focusing student-centered interaction and developing different kind of methodology. I think still it depends on the institutional policy, how institutional top management, they are actually interacting with faculty members, and also faculty members, they are interacting with students, and then also from bottom-up approach. I think this is not only from top to bottom, bottom to top, so that we can see the flow of knowledge is actually flowing very well and smoothly, and then we can also formulate policy based on that kind of national platform.
Thank you.
And,
so
yeah.
I think, sorry, go ahead. No, please finish.
Yeah, just few, one of the points, the awareness, as I mentioned, the lack of awareness, I think to realize the urgency, I think print media or social media, other creative ways, I think we still, this broader media, I think they can also help us to disseminate, to translate our methodological approach across the country.
Thank you.
Yeah, thank you.
Yeah, so you're talking about how do we start developing platforms for collaboration, also taking a much more base of pyramid, bottom up approach, because that's how innovation actually takes shape. And then of course, engaging media, how do we disseminate what's working and innovative? So thank you, that's incredibly insightful and very practical, I think, from both our panelists. Now I'd like to go to our student again, panelist student, Ms. Shumaila. From a student's perspective, if you talk about skills learning methodologies, maybe just briefly describe to us, what are some learning experiences that you found meaningful and engaging that stimulated your skills learning outcomes?
For me, the main thing throughout our MPH program was, those, as I earlier mentioned too, the facilitated kind of discussions and group works and, different projects that we worked on that were based on identifying the needs of the communities, identifying the problems, and then working on the solutions, thinking in the practical aspect, and then incorporating those different campaigns, facilitated field visits that were part of our different, courses. And then for most important thing was those all group activities where we actually, where we were pushed to actually think critically on being independent as well as working in groups. How are we coming up with some kind of practical kind of solutions to what are the real world problems that are existing out in these communities that are specific to the public health problems and the people's needs. So this whole year program was based on these integrated approaches where students and faculty were more of, it was not like just a lecture based, that I would say, like a faculty coming in, giving you a 2 or 3 hours lecture and it's gone. No. So there was more of like pushing us to think critically, analyzing the context, analyzing what we are actually, taught in the class, and then thinking and putting it into the community-based programs and projects that we actually worked on in the classroom. These were some of the effective learning approaches that were used in the classroom that actually helped us to get prepared for the work that we have to do once we are out of this classroom and then working in the real world scenarios.
Thank you. Maybe I'll just have a little follow-up question on that. So you are back in Pakistan, you're working in a community. Can you maybe share quickly what are the skills that you developed that you're seeing that you can apply now into your work?
Yeah, so I'm working as a senior program officer and I'm overseeing different donor funded projects as I'm working with one of the health departments over here. So some of the skills that I already mentioned that I'm implementing or that I'm using in my, field of work right now is, the management and the leadership skill that actually I developed from my classroom activities, the better communication and, the teamwork and the collaboration skills that we actually were taught in the classroom through all those group activities, group projects that were given to us, and then presenting our ideas by analyzing and interpreting the actual needs of the communities. When you are going there, when you are evaluating the needs of the communities, when you are looking into the problem context specific to the culture context where we are coming from. So, those all, then again, deciding what is actually the need of the community and then putting it into that whole project that you are designing and then, going into the field, feeling independent and confident to use those different approaches that you were taught in the classrooms. So I am kind of, when I was back to my field of work, and though I was studying and I was already integrated with the work that I was already doing. So these all skills actually helped me to, critically think and analyze what actually I am doing in my field of work and how I can integrate those approaches into the work that I'm doing in terms of sexual and reproductive health, gender-based violence issues, the rights for health rights of the male, female, girls, adolescent girls and boys that we are working in, considering the contextual needs in my community. So these are some of the skills that I actually learned and taught by my professors through those or different approaches in the classroom, which I am being able to easily implement in my field of work right now.
Thank you so much. Very comprehensive view of how you've practically taken your learning and applied it directly into your respective work. That's very inspiring to hear. I'd like to turn now to Dr. Anya Krumaich and hear from you as our technical partner. What did you find that was innovative about the learning methodologies that faculty designed?
Yes, well, before I say something about that, I would really like to congratulate you with, can you hear me?
Yeah,
yes,
we can.
Go ahead.
Yes,
go ahead.
Go ahead.
Okay. Okay, thanks. Before I say something about that, I would like to really congratulate the Mikhail and Sabina and the BRAC team with this project, because the way you designed it is, of course, also exactly according to your own principles. And what we did in the last 3 years with 9 teams is exactly student-centered learning. So in the starting point of student-centered or active learning is, of course, that you force students to not only acquire pieces of knowledge and experiences, but to actively put it together into insights about real life situations. That's actually what you're doing. And that helps students to develop analytical skills, critical skills. It helps them to practice and to immediately connect their experiences and their knowledges to real life situations. And those are the situations that they will be working in later. That means that students are far more easily able to mobilize the knowledge when they are in their work, in their fields. And it is also the starting point, and that's very interesting and important, I think, of a cycle of learning that goes on for the rest of your life. Once you have acquired these kind of skills, you will do that all the time, automatically, without even thinking about it. And that's very important also for jobs and careers that are constantly changing. You're kind of equipped in a generic way to constantly construct actively and critically what you know. And this is a kind of cycle that we went through with all these teams. We let them struggle with curriculum design themselves. Of course, facilitated that learning process. That's what you do in this particular approach. And what struck me very, very much is that I have been going through this process, of course, in Maastricht, many years, but it was very interesting to see also how every time you go through this process as a teacher, you are constantly also actively reconstructing, adjusting your own experience and your own insights in how you do things. And I must say that teaching becomes not a matter of, transforming what you know to another, but in the process of letting others learn and thinking along with them, you learn a lot yourself. So it is, you teach students lifelong learning, but as a teacher, you do also a lifelong learning. And it's very important that you're open to that and understand that and use that to the fullest. And when I saw this teams going through it, the way they were thinking, the way they were, trying to see if that would fit in contexts that are different from Maastricht, that also enriched a lot of my experience about teaching. And it gave me a lot of new ideas also for the European context. Somebody said, well, we need to look at countries like Bangladesh and see how they can connect academia with the people in in the streets and the villages. But this is something I think you might do better than we do, or at least in a different way. And so we constantly keep learning, and even by a small change in your teaching methodology, you change academia and you change, I think, also the connections with society as a whole. And that is the lessons that I learned, and that goes beyond, and what Shumaila was saying is exactly to the point, but this is only the start. This is what you keep doing for the rest of your life, if you do it properly. And I think one way of getting it into the universities is to invite, but maybe with a few incentives, also the older teachers to go through this process that the other teams went through this year, because I think that will change them effectively in the way they think about teaching. Thank you.
Thank you, Dr. Anya. That was quite a lot to think about. So very interesting perspective. I hadn't thought of that. It's also the hearing from you that sometimes the learning experience, when it happens organically, the lines between the faculty and the student blur, and everyone becomes both a student and a teacher in the process. And this notion of life, it's a continual learning, a self-generating cycle of learning throughout your life. That was something that I think struck us, that we hadn't really thought of that. So that's great to hear from you. Thank you so much. So I think this sets up for us a very broad context of how to think about skills methodology design to really constructively address these, whether it's climate change problems or what have you, community health problems, looking at it in terms of solutions. So now we'd like to go to our presenter. We'd like to introduce Professor Rabbani, and he was one of our faculty who participated in skills-based methodology design in this project, and he addressed some of these challenges that our panelists noted with some really creative and innovative student learning solutions. Professor Abani, the floor is yours.
Thank you very much, Mikhail. I hope everyone can hear me. Good afternoon, everyone in Bangladesh, and those of you who are abroad in their different time zones, good day. What I will do is I'll see if I can share my screen. I hope everybody can see my PowerPoint slide.
Yes, Ravani, sir, we can. Thank you.
Okay. All right. It was very interesting to hear everyone's viewpoint in this panel. And I was, you couldn't see me, but there were times when I was nodding my head, and there were times when I was I was a little bit puzzled. But I think that it's very interesting, and it's a learning experience to hear everyone's opinions. What I wanted to do today is I was part of the project and the Transform PH project. What I wanted to do is dive deep into the things that we did for our course that we decided to transform, and try to explain to you the challenges that we faced and the things that we learned. And hopefully that will be a starting point for all of us to think more deeply about the whole learning process and the learning ecosystem that we have. So a bit about myself. My name is Rabbani. I'm at Independent University Bangladesh, and I'm also representing ECAD. And as I said, I was part of this project. And at the very beginning, this was a 3-year project. We identified 3 modules that we decided to systematically redesign. The first one was climate change and health. There was another one called climate change and society. And then there's another one called disaster risk reduction. So these were the 3 courses we decided that would go through this transform process. All of them had elements of health in it. Obviously, climate change and health had a huge element of health in it, public health. But the other 2 also had elements of health education in there. A lot of us were involved. We are a small department. We're not that big. And we have about 12, 13 faculty at the time. So a lot of us were involved in this project. So there's the name of everybody who got their hands dirty, their feet wet, and actually worked for at least a year on all of these projects. So what I want to do is I want to talk about the course that we changed, that I was involved in, that we, with my team and the external experts, we worked basically 1 whole year on transforming this course. The course was called Air Pollution and Climate Change. Now, the intention of this course was to have practitioners in the field of environment development and public health. They would understand the science behind climate change, the human contribution to this crisis, the impacts on society, and possible methods out of the crisis. This was the intention when this course was first designed many, many years ago. The content that was in this course was more atmospheric science, air pollution, modeling, a very, I hate to use the word hardcore, but it was very science-based, numerical analysis-based course. And why was that? Because it's a pretty old course, and several faculty over the years have made changes to the course, and they've put in their favorite topics into this course over the years. And I've heard someone mention about being top-down approach, and it was definitely a top-down approach. When the department or the faculty teaching the course, whatever topic they think is what the students should know, they have been included. So what happened to this course over the years? Well, it became jam-packed with content. Okay, so we have a 14-week course here at Independent University Bangladesh, and in 14 weeks they had literally had 12 or 14 topics. So it was jam-packed with content. The idea being the more content, the better. Okay, the more content we can deliver to the students, force feed the students, the better. Okay, that was where this course stood at. Some of the topics that were covered were not relevant or relatable. Things like details on air pollution modeling is not really useful to the students who are taking this course and going out into the real world. Yes, if you become an academic and you go off and do modeling, good for you, but that is an extremely small percentage of students. Some of the topics have become more relevant over the coming years, things like adaptation and climate finance and
loss and damage that Professor Salamul Haq would be glad to hear about. These are much more part of the conversation of climate change now. Those were not included in this course. And of course, a very traditional method of teaching, PowerPoints, presentations, readings, go home and read a few chapters of whatever it is. So these were the kind of things that this is where the course stood before we decided to transform. So when we did decide to transform the course, we decided to put an emphasis on the students first. So student-based learnings, what do the learners need? What are they looking for? What will be useful for them? So there was a whole long discussion on designing this course so that there's a logical progression, going from terminology to analyzing content to suggesting the remedies. We also decided to change the name to Climate Change and Society, which better reflects what we actually wanted the course to be about, rather than the old name. And through our training, we learned that we have to focus on helping learners learn rather than what teachers are able to teach. And that is a big problem, not only for this course, but other courses as well. What faculty do is they gravitate towards the topics that they're more comfortable with, that they can teach, rather than what the learners need or what the learners need to learn. And so we had to learn ourselves, we had to think and figure out how we do that. So what we did, we came up with learning objectives. I'm not going to go through all of this, but what we decided to do is make a visual representation, an organized way of looking at, okay, what are their objectives? What are the skills that we actually want to teach the learners? What will be useful for them? What kind of assessments we'll do, and maybe differentiate them in chapters so that there's some sort of a structure. So this took a long time. This took a long time to come to. To come to this diagram took a lot of soul searching among the team, and also a lot of discussion with our external experts. We had to get rid of many of our favorite topics. We had to include topics that we are not comfortable with, and this took quite a bit of time. Okay. Now the challenges for that is, how do we as facilitators constructively align this lovely diagram we made? How do we align the learning objectives, the skills that we need, the assessment methods, the teaching techniques? How do we align so that we actually deliver what the learner wants to learn? And that also was something that we had to figure out, that, okay, every session we make, every class we're doing, every 15 minutes of discussion that we're doing or activity that we're doing, how does it align to our overall learning objective? How does it align to everything that we want to do? So constantly thinking about what we are doing in the class and then aligning them with this whole overall picture that we have was a very difficult but rewarding exercise. It was difficult, but it was rewarding. The whole assessment method, how do we do that? How do we give feedback to the students? Now, assessments, in the traditional way, assessment is a way to find out if learners have learned what we're teaching. So Newton's first law, do you know what Newton's first law is? Then the learners, the students give back a rote memorized Newton's first law, and then you know, okay, he's learned Newton's first law. That's the old way, right? But when we do an assessment, it took it did not occur to us that, you know what, a feedback on an assessment is an opportunity to learn for the learners. They actually learn from the feedback to the assessment. This never entered our heads. So this is something that we have to incorporate into this program, into this course, and we learned how to do that. The good thing was, for this particular course, I was teaching this course at university, and we were actually reforming this course while the course was running. The semester was running as we were training. So it was very interesting, because we would do mock session with our students. We'll try things, some would work, some would not work. So we would put those things all into the course design. So it was kind of a fun way of doing it, while it was like while the semester was running. And we learned that, you know, one size fits all approach is the mantra that we practice here at the university. Well, you've got 20 kids, let's reach out to the majority of the kids, the ones who are stragglers, well, bad luck for them. The ones who are excellent, well, good luck to them. You know, in our traditional method of teaching does not incorporate the concept that, you know, every learner learns differently. Some are more visual, some are, they like to write, some learn more when they write, some learn more when they do, some learn just by watching. So we had to incorporate all of these into our courses when we transformed the courses. So one of the big takeaways from this process or this project was the facilitator, how we had to change. I think someone mentioned that the problem is the teachers themselves. They have to learn how to change how they teach. So in this program, we learned about different learning tools, online and offline methods. We learned to differentiate between things like deep and surface learning, and understand the importance of student input, which is sadly lacking in many of our courses, not only in our university, but all over Bangladesh, in many universities. The idea that you go into a class and ask a student, what do you want to learn today, is absolutely unthinkable for a faculty, for a professor to go into a classroom and ask students, what do you want to learn today? Tell me, okay? And it's just unthinkable. So understand the importance of student input and get the students to say and reflect on what they know about a subject, rather than us, the facilitators, providing an explanation. And we understood the term eliciting a response and how to elicit a response from a learner, rather than for us to feed what we know or what we think is important onto the learner. And me personally, one of the things I had a problem with is the concept of silence. What I mean by that is, maybe you can tell through this online thing that I am a chatty kind of an instructor. When I go into a classroom, I talk a lot. And I thought I was doing great. But then I realized that if I'm doing most of the talking, then I don't get to hear what the learners are thinking. And one of the big things I had to learn is to shut up, is to have silence in the classroom is okay. The knee-jerk reaction I got when I would ask a question or ask them to reflect, and in Bangladesh it is very common for students not to speak up. They will, seconds will pass by, minutes will pass by, nobody's speaking. And I, as an instructor, am extremely uncomfortable, but I had to learn that, you know, silence is good. And then after a while, after some silence, a learner would break the silence. And then they would start talking. One by one, they would start talking. So that was something that I had to learn how to do. It was, again, a difficult thing to train myself to do. I'll just give you, again, very quickly, some examples of what kind of things we did in the classroom, what we did. This is an old slide. This is a slide that I used before we transformed. What factors determine climate? I give a list. This is on a slide. I tell the students, look, the factors that determine climate is A, B, C, D, and E. But once we transformed, what we decided to do is we asked the students what factors determine the climate. And I, as an instructor, was gobsmacked. I was surprised. So this is what we did. We put down the question, what factors determine the climate? And we asked the students to put labels and, sticky note labels. This was done online. Sticky note labels on what they think are the factors that determine climate. Yes, you got the rainfall and the temperature and the wind and air mass, which is the expected. But you got things like human influence. You got things like ozone depletion. You got things like Earth's orbital changes. All of these things, vegetation, all of these things came from the students. And these are fascinating answers, which starts to become a starting point for a discussion which leads to deep learning, a deeper learning of the concept. And this was led by the students. I, as a facilitator, just made sure they were on track and things like that. But the students basically came up with these answers. So I was pleasantly surprised. Another example I will give to you is this is a mind map that, again, the students came up with. They came up with the mind map. This is Earth's energy balance. Traditionally, what we would do is we would tell the students, look, this is the Earth's energy balance. Look, here is a diagram from a textbook. Follow the diagram and you will understand everything. Let me know if you don't understand, or let me explain to you how this diagram works. Here is an example where the students themselves, in a collaborative manner in a classroom, they came up with this diagram. It's messy. It's at some places it's not correct. But then we had all these conversations about things like the influence of atmosphere and entropy and all of these comments and topics that came out of that discussion that would have never come out if I had just given them a diagram and asked them to learn or memorize it and come back and now you're educated. Another example, this is, I basically asked the students, okay, so we are trying different things. These are not the normal way of teaching, and I'm trying all these different techniques. I'm asking you to contribute more to the classroom than I do. How do you feel? How does it feel? This was near the end. And the biggest answer was interesting. Now, as a facilitator, if you can make a student interested in a topic, then in my humble opinion, you've done your job. Okay, it's not a matter of them knowing everything, but for them to be interested in something so they can go off and learn on their own. There are, of course, very many answers here, total different activity, and there's some funny answers here, but students will be students. Easy peasy lemon squeezy, whatever it is, students will be students, but the main answer was interesting. Some of the challenges we faced, we thought that this courses needed minor changes, okay, because it's a well-established course, everybody does it, we need minor changes. But it turned out that we had to do a lot of changes with more defined objectives, a learner-centric approach, a student-centered approach, a skills-based approach. There's a lot that needed to be changed. Designing the course content from the learner's perspective rather than the instructor perspective is not something we're used to. Is not something I'll call myself a traditional instructor, are used to. Many of our friends in the faculty are not used to doing this. When the language that we used for the sessions was too teacher-centric, okay, I think that this is something you should learn. This is something you should know. This chapter is important, very teacher-centric. We had to learn how to talk differently, think differently. And one thing we found is that if we went too far, and Anya is here, and we did have discussions on things or techniques that are used in Maastricht and other places, which are very avant-garde in their teaching, they do a very experimental kind of teaching. We found that if you do something like that, then students are not used to it. So we have to find the right balance and slowly ease the students into this different way of approach, where the learners are at the center of the teaching experience. We are not used to it. The learners or the students are not used to it as well. So find a way of somewhat easing into it rather than coming into it. How to work in a pandemic situation was a challenge. It was a challenge to all of us. But at the end of the day, it was fun. It was a lot of fun. It was fun for the students. It was definitely fun for the instructors, the teachers. We loved how the program was structured. We loved thinking about our courses and how to deliver and how to make it more effective. So it was 1 year, but it was a fun-filled year. At least for me, it was a fun-filled year. Some suggestions, I'll go by this very quickly. More programs between members of this consortium. We have an alignment of interests here and experience that I think is invaluable. More interaction between the local partners. Bangladeshi consortium is probably more important, where we talk to our local universities and make this three that we are, AUW, BRAC, and IUB, and have more interaction about similar things, in-depth discussions where we discuss something, we implement it, come back and discuss it. That would also help. No more online, please. Face-to-face meetings, can't wait. Really bummed about Omicron, but hopefully we'll have no more waves, and face-to-face meetings would be very useful. Okay, I would like to just very quickly give an appreciation to all the members on the slides. I won't mention all their names. Invaluable experience, got a lot out of all of these people here. And of course, all the other faculty and members of the Transform team at the different universities. So what I wanted to do is give you a quick run through of what we did, what I found was useful and interesting. And yeah, so I'll open it to questions and comments if people want to do that. Thank you.
Great. Thank you, Professor Rabbani, for such a comprehensive view of how skills methodology design can work for students to have such transformative experiences. I have to say, there were so many things that struck me about what you described. Rewarding, soul searching, fun, interesting. That's a lot of food for thought. So let's open it up to our audience now. Some Q&A for Professor Rabbani. Our first question, I'll just read it off. I really appreciate the insights shared. I think curriculum planning should be developed in partnership with employers and other stakeholders. How does the project address this issue to ensure that, I'm sorry, that's the previous question. Do we have any new questions?
We have that question from Ahmed Hussein, which we parked for this, which is
All right. Oh,
what are
sorry,
some of
yeah.
the changes that COVID has brought in?
All right, so what are some of the changes that COVID has brought in implementing these public health projects? COVID aside, what are some of the major hardships that one might face when they start to think and then implement these projects?
I think Professor
Rabbani Bhai, the floor is yours.
Sure,
Mikhail,
okay.
I think Professor Salimul Haq has his hand raised. Maybe you want to.
Yeah.
Okay.
Professor Salimul Haq, would you like to
Okay,
share before
yeah.
we go to Professor
Well,
Rabbani?
thank you very much, Mikhail and Sabina. I'll have to leave in a few minutes, so I just wanted to come in and share a few final thoughts and congratulate Dr. Rabbani on his excellent presentation and sharing of his experience, which was extremely enlightening for me and very hopeful. So Rabbani, please let us talk about how we make our next climate change and development course at IUB based on this learning method. The one thing I wanted to share from my own experience of working with young people in general, whether they're formal students or not, is the notion I use of building social capital. Okay, it is, and it is not by teaching, but by building friendships with people. Doesn't matter what age they are. They can be young kids, but you treat them as a friend, as a potential friend. You get to know them, you get to know what they're thinking, what their interests are, and then you become a guide to them exploring their own interests, rather than a teacher telling them what they should do. We are hardwired into being teachers. I don't like to be a teacher. I like to be a guide. I like to listen. I like one-on-one sessions with every single student and listen to what they're interested in. What do you want to do? What do you want to become when you go into the world to work? And then I ask myself, what is it that what skill set do I have or network do I have that I might be able to help this person? And it's very tailored to what I can do to help that individual. And that really is the essence of what I was talking about in getting our teachers to change their attitude from being teachers to being guides and individualizing guidance to the student. And I thought Rabbani did that very, very well. Thank you.
Thank you, Dr. Salimul. That is very, very incredibly insightful, what you've shared. I think you'll have to, I believe you're going
I'll
to
have to leave in a few minutes, yes.
Thank you so much. We'll
Thank
run
you
to
so
our
much.
question.
Thank you.
So Rabbani Bhai, the question is, what are some of the changes that COVID has brought in implementing these public health projects? COVID aside, what are some of the major hardships that one might face when they start to think and then implement these projects?
Right, okay.
So I presume the project of curriculum design.
Yeah, so there are two questions there. One was COVID. Well, you know, learning during the COVID times, it was a huge challenge. And right now that we are all used to doing this way, now we have to change back into, into coming into the classroom. So now we have another huge challenge. It's like, going back to, we forgot how it was like. But anyway, it was a huge challenge. Almost every faculty I talk to does not like online teaching, but we have learned to adjust, and we had to change the way we look at teaching. That's a whole different discussion for another day. But the whole learning online is very different from learning face-to-face. And that is something that everybody had to rewire their brains. I just want to mention that in our department, even the older faculty, because they were forced to come online, they had to change their way of thinking, which is a very positive thing. I mean, I won't mention names, but there are older faculty who would had to discard their old notes from 20, 30 years ago. They've been teaching the same course forever, the same way. But now that they're online, they had to ditch everything that they had done, and they had to change the way they taught, which is good. And Salim sir talked about how we are hardwired. This COVID, what showed us that if we want to survive, we have to change the way we think. And that's good news, because that shows you that even the older professors, those who are hardwired, they can change their way of thinking. So that was I think, a brief nutshell question about the answer to the first question. And the second question, what was the second question again, Mikhail?
Let's see. I've lost the question from the chat box.
Anyway, so
does anybody remember?
I think it's the challenge
what are
during
major
challenges. Yeah, what was the challenges on
Right.
this online teaching and redesigning in that space?
Yep. So when it came to redesigning, there were, I think, one or two challenges. One of the biggest challenges we faced was traditionally in Bangladesh, students are not used to speaking up. So getting them engaged in the classroom, asking them what they want, they were shocked when you asked them, what do you want out of this course? Some of them were shell-shocked. They didn't know they don't know how to respond. They were trying to respond with the correct answer. They think there's a correct answer. When I ask them, what do you want from this course? They all think that there's a correct answer. And if I don't say the correct answer, then somehow I'll be graded bad. So that from the student side, for them to be comfortable enough to talk and express what they need to learn, what they want, that is one of the challenges. Another challenge I also feel is that at the workplace, there are a lot of employers who are not, they know what they want, but they can't really specify exactly what they want. They get a feeling that, oh, I want someone who's very smart. That doesn't mean much. Okay, I want a student who's smart. That's what our employers tell us. What does that actually mean? So you have to actually sit down and kind of take out what that actually means. What does an employer actually mean when they say that they want a student who is smart? So that was also a challenge for us, trying to find out what skills do employers actually want. Again, I think it's something that employers are never, I don't think they've ever had a professor come to them and ask them, what skills are you looking for in a student? I don't think in Bangladesh, at least, employers have ever come across that. And so again, it's a bit of a shell shock for them as well, when you go over to them and ask them to tell us what they want.
Thank you. I think we need to wrap up this session. Thank you again. A very inspiring presentation from our colleague, Dr. Rabbani. A lot to think about. So let us now move on to our next session. This is now session 3, developing faculty capacities to facilitate skills development. So Rabbani Bhai gave us a great overview about what are the kind of learning methodologies, learning experiences that enable students to develop the right skills. This now leads us into, well, how do we also ensure that our faculty develop the right kind of facilitation skills that will enable those methodologies for skills development? And so if you notice from session 1 and 2, we looked at just curriculum design. Now we go into, well, how do we apply and teach this for student skill outcomes. Sabina, to you.
Yeah. So thank you so much to the earlier panelists. And I'd like to welcome the next round of distinguished panelists. We have Professor Malavika Sarkar, who's Associate Dean and Director of the Center for Excellence for Science of Implementation and Scale Up from BRAC JPG. We have Assistant Professor Dr. Naomi, Head of Core Program, Professor of Gender Studies at AUW, Asian University of Women. We also have a student here, Syed Ishtiaq, student of Environmental Science from IUB, yes, Independent University of Bangladesh. And we also have Linda Wallman, who's Director of Teaching and Learning, who's part of the project. So thank you for joining us. Given the limitations of time, we're going to stick to key questions and get precise responses. All of you bring a lot of experience to the table. I wish we could have hours to talk to you, but I think this is a great opportunity for all of us in the audience to learn. So I think first question to Professor Malavika. So what would you say are the two key challenges to skill-based faculty development from your experience?
Thank you very much, Professor Sabina and Mikhail Islam, for such a kind of an exciting webinar. So for me, the two key challenges, I think, one is institutional challenge. So the institutional challenge is there's no systematic approach to develop the faculty. So no organization has an actually annual plan or quarterly plan that address that for faculty development. So that's one of the major problem. Second is that we are talking about the student-centric learning, teacher-centric learning, participatory learning, but what does it mean? So the training curriculum is not developed. So when we train our faculty, we change this traditional way. So there is no change in the content of the curriculum for faculty development, bringing cutting edge methodology. And also those who will teach the faculty member, they are also not trained. So these are the three major gaps. One is that there's no systematic approach. Second is there's no cutting edge curriculum to develop the faculty. Number three, those who do the training of trainers, the faculty, who are they? How can we train them to train the faculty? So I'll stop here.
Yeah, I think there's an excellent point, and really to speak to this, often it's project-based, so we're working in silos, or we don't actually have institutional systematic review and change. So I think you're absolutely correct. I want to ask Dr. Naomi, who oversees the core program of gender. Would you like to add to these points in terms of two key challenges or add additional dimensions to this in terms of faculty development?
Sure. Thank you, Sabina Appa. It was nice hearing from you all, and I could see that our chat box is full of nice message and introduction from different people, and I could see they're from different strata of our platform, and they're from different university. There are also some young professionals here, and they're very passionate to work for public health, and their messages are giving us a very good sign that how public health has moved from a very hardcore science-based approach to an interdisciplinary approach, a right-based approach. So from there, I would like to start that our main challenge is to see public health issue from interdisciplinary perspective. We need to go beyond that strict dichotomies between science and social science, and we need to understand the multidimensional aspects of public health. For example, menstruation hygiene, which is a public health issue, but it is also a human rights. But there is also some issue in menstruation health, which is related to gender. So we need to work between discipline to improve the experience of seeking help for this reproductive right. This is one of the factor. As the head of core program, what I envision that maybe all universities should have some core curriculum which will include public health related issues, and that will give a very foundational aspects to the students about public health. This COVID-19 pandemic has reminded us that how public health issue has become a day-to-day phenomenon in our life. So even if we want to avoid it, we cannot. It is our day-to-day life, it is everywhere, and it is affecting everything in our life. So there should be core, curriculum, core courses that will give foundational aspects to all students, no matter, what major they will do later or to what discipline they will move. That's what I want to add. Thank you so much.
So a more holistic approach and some core curricula to guide us. Thank you very much. And I'm going to come to our student, Syed Ishtiaq from IUB. So what do you think some of the challenges students face with faculty teaching?
Thank you, Sabina ma'am. To be honest, I would like to talk about the fact that from my personal experience that I have done, like previously in the last session that Rabbani sir was talking about his course and how I was one of the students of his course, that we students we have been taught in a way that a traditional monotonous way of studying, right? There's been lectures and we have been going through the lectures and just straight away going to the exams. So it's becoming much more monotonous, and that's becoming problematic for us to take much more information. It's like learning, actually properly learning. We're just studying and we're just going directly to the exams and we're done with it, and later on not even remembering. So with those lectures, what happens is it's difficult for us to concentrate for 50 minutes at max. But what Rabbani sir did in his last course, as he was talking about, is that due to the fact that we were much more engaged, so that made us concentrate much more, and we were much more sad that the class ended, and that was the thing. So one of the challenges I think we face, as in some people, the students have a different way of intaking information. Like some people prefer practical ways, some people prefer taking information in a way that like the traditional lectures, because we have been trained in that way, because from our childhood that's how I've been, the entire education system has been since then. So the challenges that faculties face is every student has an individual way of learning. So to concentrate on each individual is one of the major challenges I think for a faculty to face that way. And one of the other challenges as a student, I mean, more than a faculty, is that we, due to the system, we rather end up chasing grades than actually learning in class. That is one of the problems, I think, and the faculties have to concentrate on each student. So this becomes much more difficult to teach in class and more concentrate.
Thank you. Thank you for frankly sharing the diverse experiences, but also what students want and enjoy. I think we're now going to go to solutions, questions to the panelists, right? Thank you.
All right. Professor Malavika, you mentioned probably the most critical challenges revolving around faculty development. How about telling us how we can start addressing some of this with some concrete solutions?
Okay, so there, if you think of the faculty development, there is two different types of faculty development. One is that the content of the teaching, how can we make the content more understandable, more enjoyable, more interesting, more dynamic? That's one aspect. The second is how do I teach? It's more about the modality. How do I deliver the lecture? So that, and then not only that, how can we, that what Ishtiaq mentioned, that how can we engage that if there's a diverse student group? So these are the two aspects of the faculty development. And if we really want to do that, I think if I start from the first thing, that as an institution, the authority of the university or the departmental head or vice chancellor need to integrate a faculty development program. And so that needs to be integrated. It cannot be ad hoc, that whenever I need that. So that's number one, that to integrate that we will have a faculty development program. That should be the first step. Then we need to think about that. What are the elements do we need to proceed for faculty development program? Definitely the first thing with the inventory list, to have an assessment, what is the weakness of those faculty? That's the Herculean task. because we are arrogant enough not to think that we are bad teacher. We are arrogant enough not to think about that we need to improve we need to update our kind of a content. And also they accept the fact that I can be the best scientist, I can be the best researcher, but I'm a terrible teacher. My delivery is really, really awful. So how can we motivate that? So I do think that that's the most difficult for a dean or vice chancellor or head of the department, that how can convince the faculty. So then I think I can't give you that's the magic bullet, but there need to be a kind of a discussion that how can we improve, and so that how to bring those faculty on board to identifying the weakness of the faculty. Then third is the developing the curriculum, that what kind of curriculum we need, that and also I do think that I don't think that it happens, that can we develop a core team that who will go through the slides of the faculty, because sometimes we come for an 40 minutes lecture with a 75 slides. So that is it possible institutionally that to kind of a review of that. And it's also important that many institutions, including JPG, that we have the student evaluation, but these are very vague. Even our evaluation, we need to be updated. They are not specific, and students sometimes give the evaluation based on their kind of an dynamics, the relation dynamics with the faculty. So if the faculty is very tough, they say teaching is bad, or teacher is very rude, teacher did not teach, but they are not very specific. Definitely it's possible. So can we have a very good the strong student evaluation with the indicator and with the specific? So there is no the general comment. Even if I say that, okay, Mikhail's teaching is bad, what does it mean by bad? What is bad? Or I did not learn anything. What did not I learn? What was my expectation? So that's also need to improve. The final thing is that, the resource allocation, because if we really want to train them throughout the year, and it is possible that there might not be, we don't have the resource that or capacity who can teach those faculty on those. So we maybe need to outsource it, bring somebody who is specialist, but then there have to be resource allocation for that purpose. So these are the things I would say that kind of steps, but definitely it's not an exclusive list. But I will kind of end one thing, that the most important element to kind of faculty develop is an open mind. From the those who will implement that, from students, and definitely the faculty. The problem is that all of us, including myself, I'm also faculty, we in a certain age and after certain time, our approach that we know it all. And that's to me, that's the stopping of our growth. So that's a huge task to motivate the faculty to participate and to accept the fact that sometimes actually we really bad teacher. Yeah, over.
Thank you, Dr. Malavika. Quite an extensive set of very, very concrete solutions. What struck me really was the first point, though, that how can we get our students to be more engaged when whatever we're being taught as faculty is not engaging? So we're perpetuating the same system of learning that we're receiving onto our students. So we have to holistically and systemically look at how our curriculum and learning is done. So I think that's a very powerful metaphor, I think, for how we need to tackle this. I want to move on now to Dr. Naomi. You identified some key challenges. What are some solutions that you can think about, offer us?
Okay. So I think what you have mentioned, that is very, very important, that how can we have something that will make the student interested and they want to learn about it out of their interest. So maybe we can choose the topic which is part of their daily life. For example, period poverty. or something related to reproductive health, which will make everyone interested to learn regardless of their gender. And it is also related to an interdisciplinary approach to public health. So just imagine that what if all the universities in Bangladesh have a core course which all students need to take, and that is a public health course, but it has an interdisciplinary dimension, and it is related to something that is our day-to-day life phenomena. And to have it on experimental basis based on student evaluation and a very community-centric pedagogy from a group of teachers, not from one lecturer, but a group of lecturers who are from academic discipline, from medical science, from social science, and then see what is the impact, that how the students are using the idea in their professional life, in their next level of research. So if we can do something on experimental basis and learn from our trial and error, then we can actually know that how we can design more effective intervention. So that could be one solution, to have a core course in all the universities that is related to public health, and not to have just one faculty, but to have a group of faculty, combination of from different disciplines, to teach public health courses and to see the result on the basis of evidence-based research.
Thank you. So I think having co-facilitation with multiple faculty, just this notion of just always having one faculty, I think that's a great point, that we need a more collective teaching experience with our students, and that can also lend more to their learning outcomes. I really appreciate that insight. I'd like to turn now to our student again, Mr. Ishtiaq. You are the key for all of this as a student, for our faculty, our profession, for faculty's profession. Tell us, in your experience as a student, what kind of faculty teaching really works for you, and to learn and develop your professional skills?
Thank you, Mikhail bhai. I think like the faculty to be like, to learn for us, I think they have to be much more friendly and engaged. I think as Dr. Samuel was mentioning in his last session, and I was very like to be best friends with us, because thing is, if you're just giving lectures and you're just talking about it, and we just get bored at times, like being engaged, being friendly with us and interacting. And I think having an engaging session, what gets us like more engaged in our like studies and whatever we are learning, and how we like interact with each other, and also engaging in groups, and all on a personal level as well at times, because a lot of people's are like how a lot of people are introverts or extroverts. Some people take information in a different way. So like I'm rather much more like much more vocal in my class, but some people are not. So some people might be easier in much one-on-one or face-to-face interaction, or one-on-one interactions. So I think like having that friendliness with the faculty is that much more helps us to develop ourselves and know ourselves and how we want to learn, how we want to interact in class, and helps us to grow in that way.
Thank you. That's great to get that very direct student perspective on things, which I think we always need to bear in mind as we tackle these challenges. I'd like to now move to to Linda, our technical partner, Dr. Linda. If you could maybe share with us, what are some of the innovative faculty development solutions that you saw in the Transform project?
Thanks very much, Mikhail, and thank you very much to everyone who's been part of this national symposium. It's been really fascinating, and I've been listening since this morning, and I've learned so much during today as well. So I've got 4 highlights, if I may, Mikhail. So the first thing that really we thought was incredibly innovative from our perspective was the use of participatory methods to teach natural science. So we've been very accustomed to using participatory methods in social science, in development studies, in public health, but this is very new to us, to seeing it being developed in this way, and also under COVID, to using virtual labs to virtual reality labs to kind of do experiments at home or individually or on campus, and to test things that have been learned in class. So we use this at IDS, we use this on another project to persuade funders on another project who were saying participatory approaches can only work for higher education that's social science orientated. And because of our experience with Transform, we were able to say, actually, there's been a huge innovation in this work happening in Bangladesh that we can build on and grow on. And we really valued this opportunity to work with natural scientists and to move from courses that, as Rabani has explained, were very rigid in their approach, and thinking about how they change and how we respond to it, and thinking about a topic like climate change moves so quickly. In the 3 years we were working on Transform, the topic itself was changing all the time, and working with them enabled us to do that. So we thought that was fantastically innovative and interesting. The other thing that we thought that Transform did incredibly well and really excited us was the way in which participatory methods and the teacher-student relationship really changed from didactic lecturing, from standing and telling the class what you know, to very interactive learning and doing, even while online. So earlier in today's sessions, we've heard about the challenges of the teacher barrier, the fact that so many of us teach what we're familiar with, what we're comfortable with, what we learned in our own, when we were students, we reproduce that. And what we tried to do on Transform was we tried to teach in the way we wanted the lecturers to apply their learning. So what the sessions with IDS did was we didn't give you lots of lectures on the pedagogy of participatory learning and teaching. Rather, we dropped members of staff from IUB, from AUW, and from BRAC JPG into a participatory environment. We said, here's a classroom, and you have to engage and create and develop and do group exercises. And the very act of doing it, the very act of seeing your colleagues doing it, the very act of struggling through it and practicing it and trying it and getting feedback really created exposure to these ideas and to these approaches, and developed a sense of learning and an ability. And really what we wanted to come out of Transform, and I think we have done this very successfully, is not to teach you that if you have an exercise, it will always work, and that you can always just do an exercise, but the skill and the ability to manage classroom exercises, to manage those spaces, and when things don't work, to stand back and re-explore and find new ways of developing and learning and creating student engagement in the classroom. So we saw a huge amount of innovation, and I think everybody learned how to manage those processes. So I think that Bangladesh has the basis of participatory pedagogy. And we've all learned that this is a constant process of learning, of exploration, of examination. And so you can start to build from this. And there is a community of practice around the world that does participatory pedagogy in classrooms. So we have the basis for the kinds of challenges that Professor Naomi was talking about. And I think that's so fascinatingly interesting. The other advantage of working in this group interactive way is that, picking up on earlier discussions today, it allows students to bring their interdisciplinary learning to the experiences, to the problems, and to understand the problems in a much more holistic way that we as trained lecturers who've been trained quite sectorally can't do. So the third innovation that really, really excited us was this ability to use participatory activities for very sensitive and personal topics. And I won't talk much about this, we've mentioned it, but the teams from AUW, JPG, and IUB all kind of dealt with topics that might be sensitive, might be taboo, might be very personalized, things like diabetes, obesity, food contamination, menstrual health, child mortality, these kinds of topics. And by making it both personal and by making it exploratory and getting students to share and talk about it, you make it both personal and academic. And that really adds meaning and excitement to it, both for students and for the lecturers. So we thought this was really, really exciting. And then the last thing I really had to say was that for all of us working on Transform PH, we were so bowled over by the real enthusiasm and commitment that everybody had to this project. People kept working despite COVID, despite the many interruptions and challenges. You know, we went online, people got sick, people got COVID, people were working from home, they had other commitments. We were all under stress and anxiety situations. People worked in different time zones. When they traveled, they still committed to it. And the mentoring that we had within Transform was really good. And we saw a process of institutional learning happening in Transform. So in the first year, there was a lot of nervousness. We all focused on the deliverables. We were all thinking, what do we have to do and how do we do it? How do we do it? And what is it? What is this thing that we have to do? Whereas by year 3, we had in-house mentors. We were much more able to relax and focus on our concepts, on Indigenous contexts, on skill-based learning, on community-focused learning. And we saw the confidence of our educators grow as they became exploratory and innovative in their approaches. And we also saw progressive improvement of the process of managing Transform over the 3 years. We all understood it better, we all learned better, and we were able to take shortcuts and work it out much easier way. But really this culture, this happened because of a strong culture of informality, collegiality, huge trust, incredible communication coming from Bangladesh, flexibility and support amongst the university teams. And we couldn't have managed it without all of this happening. So for all of us, for you in Bangladesh, for us at IDS, for people in Maastricht, we really had these opportunities for learning, for exchange. I think we all learned an enormous amount. Certainly we will be taking ideas from Transform into our teaching and our classroom. And what we've managed to do is really produce this rich field-tested set of resources, which we've produced collectively, all of us together, and which we really hope will help all of you to take education further into Bangladesh, to share this methodology, which really inspires and produces such excitement in the classroom, and to build on the basis that Transform has started. We really hope that this is not the end of a project, but the real beginning of a movement in Bangladesh of doing this kind of thing. Thanks very much.
Wow, thank you, Linda, for such an inspiring kind of description of the project and your own experience. That it's just incredible to hear that from your vantage point as well. I'd like to now take all this, this has been a great setting up of the context for faculty development. And now I'd like to introduce Professor Monir Zaman Molla, who was a faculty who participated in faculty development in the Transform project and addressed some of these challenges and incorporate a lot of these types of innovative faculty development solutions. So Professor Molla, the floor is yours.
Okay, can you hear me?
Yes.
Okay, thank you, Mikhail, for the introduction. And let me just start by greeting you all. I think, for some it's afternoon, for some it's night, and for me it's going to be early morning soon. So can I share the slide? Let me just share the screen. Let's see, where is my slides? Here, I think. Okay, let's see. Okay, can you all see it?
Yeah, we can.
Okay, very good. Okay, of course, this is the first slide, which is common to everyone, right? Very colorful, very pictorial, and good title and all this. Of course, the next few slides, you won't see that. It's more of a text, but I did that on purpose so that audience can have some imagination to fill the background to make my slide more contextual. Okay, with that, Okay, let's see. So let me just start by acknowledging. I know that we are end of a 3-year journey, which seems to me like it was yesterday when Professor Sabina approached us, wanted AEW to get involved in this project, and we all were excited. And before you know it, it's already end of 3 years. But as Linda said, it's not the end. It's actually a beginning of new journey that we will embark soon. But again, let me take this opportunity to thank all the participants over here, the institution, the local one, BRAC, IUB, and AEW, along with our partners abroad, that is Maastricht and IDS. So thank you very much. It was a great opportunity and journey. I can truly say that I'm sure all of us enjoyed it, especially the first year. I remember going there physically to different places, and we had our great moments, and I'm sure we can share some of this in other times. Now, moving on to the talk for this session, faculty development. What I heard from the panelists, a lot of points and very crucial, important points, and all of them are relevant. And of course, as a scientist, you have to say all of them are factual, true, right? And we also heard a lot of solution to, or potential solution to all these challenges. And again, very good solution, okay? And when I'm trying to relate the challenges to the solution, you know what comes to mind? AUW. Why? Because it seems like we have been practicing all this solution there already. Things like assessment is a very, critical component of our, faculty. Open-mindedness. I think we have a lot of that. Perhaps we even have more than what we need sometimes. Friendliness. Yes, I think if you ask any AUW student, one of the things probably they will tell you is that AUW faculty are very friendly. I have never seen like this in other institution or the high school or other, public institution in Bangladesh. So all these things that were mentioned as potential solution, like also Naomi mentioned about core, AUW right there. We have a core component of our whole curriculum, which, gives the student these opportunities to expand their breadth. They can major in anything, but they can also expand the breadth and learn about almost every potential field of education. So we have all this. So I will just mention some of the key points in what we have in AUW in terms of the faculty development, and also give you some of my personal experience as a faculty, teaching and developing as well. Okay. Now, when we talk about faculty development, of course, we have to, understand that it depends on the type of education. And if we look at the type of education, over all over the world, you could probably divide this, the education system in a couple of model or system. The thing that comes to mind, the British system, right? Which have really, put their tentacles to most of the countries, the Commonwealth countries, right? For obviously historical and political reasons. And then we have the offshoot from the British system, the American system, right? Where, you take something from the parents and you modify and become a system, a new model. And of course, we have the in between, the European system, right? So what I want to say is that when you look at the education system in our world, what we have is unity through diversity. We have the basic education that we all want to disseminate to our new generation, our student, right? But we do it in a different way because we are different culturally, geographically, politically, and nationally, right? But there is this unifying point, that is, we want our new generation, our student, to learn, acquire knowledge. And the way we do it might be different, but the unity is there, right? So I think these are some that have already been mentioned by the panelists. The challenges, and I think this was also mentioned by other panelists in other sessions. Change is sometimes fearful, right? Because we don't know what this entails, what this might entail, what is the risk, what do we have to do? I might have to do extra work. I might not be, competent enough to, inculcate the new finding, new innovation. So it's better to just stay with what I know, what I have been doing, right? i.e. going through the same old, right? And of course, I think the lack of resources is a very important component of this challenge. I'm just projecting some. I know a lot of them were mentioned. And of course, lack of incentives. This was also mentioned, I believe, by Dr. Haq, Salimullah Haq, that why should I take this extra, length of work, so to speak, if there is no incentives, right? So incentives become very, very important. So these are some, and along with many that were mentioned. Now, just to reflect on what we have done in this Transform project, is we have a very good symbiotic relationship in terms of how this process actually went. We had the curriculum development, which was done by Maastricht, and then we had the training of the faculty, how to actually put the curriculum into action in a classroom setting, which was done by IDS. And I have to say, we had very, instructional yet very entertaining, time when we did this in first year. Of course, the next 2 years was online, but the content was there, the excitement was there, the entertainment was there, maybe in a different way, right? But I see this process that in this project as a very symbiotic process where things are very well thought, well planned, and of course executed. Now, let's talk a little bit about AUW. As I just said in the beginning, AUW pretty much inculcate most of the things that have been already mentioned by the panelists, both in terms of the challenges and the solution to the challenges, right? The fact that AUW is not only diverse from the students' point of view, we have students from 19 different countries, but we have equally diverse faculty from different countries, pretty much from all over the continent. That, in fact, also bring the different technique. Our faculty bring different experience, different skills of teaching. And of course, learner-centric, as has been mentioned again and again by many of the panelists here, is one of the core concepts that our faculty emphasizes. And also, I think this concept of interdisciplinary teaching is also very prominent in AUW. The fact that we have this core program, where we have science, we have social science, we have humanities, it involves faculty from all those departments, right? So it's very interdisciplinary. And add to that, a lot of our courses are team taught. 2, 3, or even 4 faculty teaching the same course, where the faculty bring not only different skill and experience in the field, but also different methodology of how to deliver, disseminate the content, the knowledge to the student. And also, of course, we have a lot of this group discussion and all this, right? Both small group and big group. And, you might say, oh, COVID has taught us how to do digital teaching. Yes, it did. But for AEW, this is nothing new. We actually had faculty teaching, long distance, right? Before COVID. What COVID did is it enhanced, it expanded, and it brought up new methodology. Now, in terms of this curriculum and faculty development, AEW emphasizes on 3 main areas for faculty. One is, of course, teaching, research, which we believe research enhances teaching, teaching enhances research, and of course, the community work, okay, where we have a lot of committee, we have a lot of workshop where we have the faculty, sit and go through a lot of this curriculum development related issues, talk, workshop, and all those, right? And I should mention this team teaching, it's not only bringing different skill experience from faculty, senior faculty and junior faculty, but this is also an opportunity to train the young faculty. So a lot of time what you'll see in AUW is when we have team taught courses, we have a senior faculty and a junior faculty. The senior faculty serving as a mentor to the junior faculty, right? This is another way of developing faculty, right? In addition to your formal workshop and all those other institutional program. Okay, so we have a built-in mechanism to train our faculty. Okay, and then the emphasis has always been, developing, not only the content and curriculum and the syllabus, but also developing faculty to deliver those content, right? In a right way, in a conducive manner, in a friendly manner. And I think, taking all this together, what you will see in AUW is we are very progressive. It's not only a mixture of different faculty with different skill experience and different methodology that is being taught, but they are also always on the cutting edge in terms of introducing new methodology, bringing in something new that is, very fresh. Okay, so we're very progressive. Now, in context to why is AUW a model for this particular project? Well, first of all, let me tell you, we have a very strong science program here, in particular, the public health. Our public health program is, the flagship for our science program. Okay. Even though it's undergraduate, we are very proud to say that, our student, after graduating, has gone to pretty much almost all the continent, America, Europe, Australia, Asia. We have students in Johns Hopkins, McGill, some actually went to Maastricht, IDS, right, Sussex, and Australia as well. So the fact that our undergraduate student with, the public health curriculum, going through the public health undergraduate curriculum, were able to go to this different top-notch institution, public health, says that, our curriculum is not only it's the curriculum that is up to par, but also I believe when you look at the feedback from their faculty, the master's degree faculty, the graduate program, they have very positive things to say about our student, which assures us that it's not only our standard that is good, but also hopefully our delivery method, our teaching method is also up to that standard. And, I just mentioned a few international institutions. Of course, our students also go to BRAC, Public Health, for their master program, North-South, along with other institutions locally as well. So how did we use this project to enhance our public health program here? Well, just like I think Dr. Rabbani was saying, while we were training with these new courses, we're already teaching, right? So as you probably know, the background is that each institution, kind of transform one course every year. So we have 3 courses in AEW. The first course was related to infectious disease. Professor Nazmul did it. The second course were nutrigenetics, which I was involved in the second year, where we had, I think Linda mentioned something about science and lab and virtual lab. That's exactly what we had. And the third one, which just completed this year, is the environmental health by Nazimuddin. So we had these courses, and while we were transforming, going through the project, we also actually, tested. So we did the experiment while we are also learning and transforming the course. And you would be surprised with the feedback. And I can just share the one that I taught, and the feedback that I got is like, oh my God, it's totally different from what it was. And it is, of course, more student-centered, more discussion-oriented. They are free to think, come up with idea, give suggestion. Assessment itself was both ways street. The faculty assessed the student assessed the student, right? So there are multiple layers of doing things, activities that all the student and the faculty alike were involved. So we can truly say that this transform course really involved all the stakeholders, right? The main players, that is, the student, along with the trainers. Right? And the fact that, myself, I was involved for all the 3 years. We had other junior faculty involved. So it was also an opportunity to train the trainer by, train the young faculty by faculty who have gone through it. So that was another dimension that we had in AEW connected to this project. And as I said, very good positive feedback. And in terms of the faculty, not only the faculty that were involved, not only the program, we're talking about the public health and science, but I think we kind of had this discussion during our meeting, faculty meeting. And I think all the faculty were on board, and we're expanding to the other program. And I think they are on board, and we look forward to a very productive, innovative, but most importantly, transform way of teaching and overcome many of the challenges that were mentioned by the panelists. I think I have about a couple of more minutes, right? So let me just share a personal, let me share some personal experience. I must say, if there is any asset that I have, my biggest asset is the fact that I was able to travel. I was able to, have a journey that took me from country to country, institution to institution, culture to culture, and experience something on firsthand. So I was fortunate to be able to teach in a private institution, public institution, a small institution, like what we have in AEW, or a big state university where we have 30,000 students. I started with teaching in a female institution, then went to a co-ed, then went to a male institution. So I had, just like AEW, very diverse. And of course, I taught for almost 12 years in the US and almost 10 years in Bangladesh. So I have experience both in the international context and in the local context, and I can see the difference. Okay, and there are a lot of good things, and there are a lot of things that needs to be improved. What I really believe in terms of teaching is, this is 2022, right? We have come a long way. Things are not the same anymore. Things have changed. Just over the past 2 years, you have seen things have transformed. The teaching technique has transformed. The whole education has transformed, right? We have learned a lot, right? But that doesn't mean that the old is always, we can forget the old and old is not valuable. I think it's valuable, but I think what would be the best model is if we could take the best of every system and synthesize something that is, as I said in the last sentence, the whole is greater than the sum of the parts. So if we could take component of each system, each institution that we have experience with and build something that is really big, that is what we need. That is what we want. And we want it to be sensitive to local, regional needs. It's great to learn from different institutions, different part of the world, but we need to cater things to our institution in the local region, in the regional context, so that, Harvard can teach something in Harvard. Their student body is different from what we have over here. So we cannot apply the same, concept that they apply here. We need to modify so it suits our student, right? So what we need is, now that we have had this local institution, 3 of the local institution partnered with the international student, we learned and we are trained. The next job is to be pervasive, expand, right? Let it grow throughout the country, throughout the region. The only way you're going to do this is through collaborative, cooperative manner. We have to join hands and we have to learn and grow together. There's no way out of that. That's the only way I think we are going to, fulfill and meet our goal. And this is the last slide I have. Yes, I think you saw it right. The title is Bangladesh, a model in making. I truly believe it, because I really believe that Bangladesh is an optimal geopolitical region where we can make this a center of excellence, in particular, public health. We have all the ingredients. And I know resources might be not up to par, but that's something that we can work on. But the most important thing is we need to have this concept that we can, we will, and we did. And let me just share one thing. I know I've gone through 3 minutes over my time.
Professor Mullah. Did you want to quickly wrap up, just because we have
30 seconds.
minutes for Q&A?
Right.
I apologize.
Yes. 30 seconds.
Really need to move.
As I said, I truly believe in this, because when I look at history, I try to relate to history. 50 years back, no one would have thought that Bangladesh could be where we are, right? And the fact that we are able to do it, not necessarily because of our, financial or resources, but mostly because our intention, our unity, and most importantly, the force that we collectively want to show, that is, do it mentally more than physically. And that's why we are where we are, and that's what's going to take us to the next level, that is center of excellence, in particular in public health. With that, I want to say thank you.
Thank you. Thank you, Professor Mullah.
Okay.
Thank you, Professor Mullah, for walking us through some of your journey on this. I think we have just a few quick minutes for Q&A. Maybe I'll just start off. Could you maybe also tell us a little more concretely about how did this process with faculty development improve your let's say capabilities as a faculty member and your courses?
Okay. So, as I said, I had diverse experience teaching over there, over here. Some of the things that we have learned was already there. But one of the things that we learned is, especially in science, right? Debate. Debate that we have learned. I think we went through this. If you inculcate debate, you get different opinion from the student, right? You learn how to take, student feedback and modify your way of teaching. I've learned that that's something new that I did not use so much because in science you don't see much of debate, right? That's one thing we learned. The fact that I think it was mentioned by Rabbani. A lot of time, you would say, okay, these are X, Y, Z, and this is what you're going to do. But instead of doing that, I used to go to the class and I said, you know the topic, tell me what you know about it, right? You initiate the talk, right? And then we'll help you out. So instead of me being the teacher, let the student be the teacher and bring up all the issues that they have. This way, they can feel what the teachers go through and the teachers can feel what the student go through. This is another mechanism that you can use to enhance your, teaching and develop your teaching technique.
So Professor Mullah, there's another question. Can you hear me?
Yes, I can.
From Associate Dean Professor Malavika Sharkar, does AUW offer a systematic approach to faculty development?
Okay, we had planned workshop, and this is part of our, as I said, the three component we have: teaching, scholarship, and community work. This falls under the community kind of work where we have workshop, we have faculty training. These are part that is integrated in what is needed from the faculty, from the program. Yeah, so I would say we do, but we definitely need to increase and have more of it.
All right, thank you. I think that wraps up this session number 3. We'd like to now thank all our panelists for all your insights and your experience with the project and just providing a very robust context for the way in which we innovated our solutions together very, very collaboratively. So thank you all. It was really a pleasure to hear from you. So let us now move on to our last session. It's been just 3 hours, and I think we've covered the entire gamut of curriculum design and faculty development. So I guess the real question now remains, is on building partnerships for sustainable health impact. How do we collaborate and scale up faculty skills-based curriculum design and faculty development to enable real health impact? Sabina? You're on mute.
Sorry, this always happens to me on these webinars. We have distinguished guest, Professor Nauzia Yasmeen, who's been recently appointed Pro-Vice Chancellor, and she's Professor at Department of Public Health, but Pro-Vice Chancellor of State University, Bangladesh. We have Professor Deepak Kumar Mitra, Professor of Public Health, NSU. We have Associate Professor K. Rabbani of Environmental Science and Management, who is part of this whole Erasmus project. We also have Professor AKM Mullah of Biological Sciences of AUW, and I will be sitting in on this panel around questions around sustainability and partnerships. Thank you.
All right, if we could ask our panelists, if possible, to put your cameras on. I would like our first question is to Dr. Nauzia. So you've patiently sat through these 3 sessions. I think now the question really remains is this, or some of what you've come across today, is this relevant to your particular department or university's curriculum and faculty development priorities?
Thank you very much, Mikhail, and thank you, Sabina. Thank you for inviting me. Actually, you are absolutely right. I just got appointed day before yesterday as the Pro-Vice Chancellor. Really, I was listening to the whole session and it was amazing. I'm working in public health for 19 years, but we have, as Dr. Mullah Bhai was saying, that it is all orthodox and we are following I will not say orthodox, but I'm just saying that it's a traditional thing that we are doing. But this is very much innovative, and I think skill-based and transformative. Education is very much important. So as a head of the Department of Public Health, I am very much willing, and my university is very much willing to adapt this, this model or this transformative changes in our curriculum, of course. And I think Mikhail knows and Sabina knows that we have already started working with you. So yes, we are very much, we will welcome this. But one thing I just want to share, it's my concern that people, this is the normal psychology of people of Bangladesh, not Bangladesh, all over the world, that they don't, they are not very receptive of changes, but that's a very good thing that some of the students shared their experiences, like how they felt at the beginning and how they adapted to that. So I think our students will also be like, maybe at first they'll be a bit conservative, or they'll be a bit scared to adapt to these changes. But I think we can do this slowly, one step at a time, and we can do this together. Thank you. Thank you, Mikhail.
Thank you so much, and congratulations. I'd like to move on to Dr. Deepak. So Dr. Deepak, at the NSU School of Public Health, do you feel that some of what we've talked about in our 3 sessions today, are they relevant to your own institutional kind of curriculum and faculty development needs? And maybe even tell us which ones kind of maybe struck you as the most common for you?
Thank you very much. Thank you for inviting me. So as far as Department of Public Health, North-South University is concerned, we try always informally to be, deviate from the traditional teaching system. One point I will focus on or emphasize on, that is the friendliness, So we, most of the time, our faculty, we say that we are friendly to the students, but not really the friends, So there is also side effects or becoming really friend with the students. So it is a little bit, difference between friendly and friend, So we try to do that, but it's not easy. We have a diverse, faculty pool. You know that in Bangladesh, it's not possible to have all the full-time faculty members who are under the control. With the department and university, we have a big pool of adjunct faculty, and then some of the internal faculty, and also there are different levels, so-called old and new. So we, that we always heard that old is gold. Now we can see that old is sometimes problematic. But I would say that old and new, this is basically is the mentality. It's not like the by age. It is the mindset, So some really age-old people can be very young in mindset, and very new and young people by age can be also old in mindset, So we try to do that, and yeah, of course, whatever we do, it's very ad hoc. There is no requirement. There is no mandate from the university. So, university is whatever you do, students get admitted, they go out, kind of thing. But we try to be like that. But as I went through all these, deliberations and all the process, it's a systematic approach. It would be very much helpful for not only, our institution. I think all the universities, those who offer at least the public health program, and they should adopt these, gradually. And I think one of the best approach is to try to, although it's very hard, try to recruit faculty very selectively, not everybody, just through process. If you, so that work is half done. If you have a very good faculty at the recruitment, your work is almost half done, but it's only half. We want always full. So I'll be very happy, and I already talked to my colleagues in the department, so they will be very happy if we can. There is a systematic way to translate this into our department. Thank you very much.
Oh, thank you, Dr. Deepak. That is wonderful news to hear that there is this level of interest to collaborate with you, as well as, well, Dr. Nazia had already initiated a collaboration on a small scale with one of her professors on a course. So it's great to see that we're already embarking on expanding and scaling up with both your very reputable universities. I'd like to now turn to Dr. Rabbani. In your experience, you were a partner on this. Do you see scope for further collaboration with other departments within your university? What kind of collaboration, if there is, might that look like?
Thanks, Mikhail. Yeah, so I was listening to everybody, and I just want to comment that, of course, there is scope for collaboration with other departments and other universities as well. But I would like to echo something that Professor Salim mentioned, that is incentive. What is the incentive for other faculty to follow what we are doing in our department? And in our university, there's already a kind of a, I would call it a buzz going around, that what is Rabbani up to? What's he doing in his classroom? What the students coming out of that classroom, they're coming out with a different kind of experience. So there is some interest, curiosity, more like a curiosity about what this whole thing is about. But then that only takes you so far. There has to be a reason for faculty to change their mindset, and changing the mindset from a very established old way of teaching. Now, in our department, we've talked about the incentives, and we've talked about how in a private university, how you teach and how many students are in your program is a big deal, because, to be blunt, it affects your bottom line. It affects your the department's income. So that could be an incentive of getting other departments interested in changing their mindset, that, look, we have done this, we have seen students being positively impacted by these changes, and this will help your students be more employable. This is a direct line from what the employers want, right through us, instructors, right down to the students. Convincing other departments of that would probably help spread it more. Right now in our university, it's more of a curiosity. Oh, you were involved in a project. What was that project about? Oh, you keep doing all these different things. But to make it more substantive and permanent, we need a structure, and we also need to focus on why we want to push this thing to the other departments as well. Overall, in our university, the Department of Public Health is on board, our department is on board, microbiology department is on board, even things like business are interested and talking to us. So there's a lot of interest, but we need to formalize it, structure it, and hopefully this will spread. Thank you.
Thank you. That's incredibly encouraging to hear that there's been such a positive response from the work you've done into other departments at your university. I'll turn to Dr. Mullah now. Dr. Mullah, if you can also share from your experience, just how do you think there would be ways to collaborate to expand on some of the elements of the learning ecosystems that have been developed within AUW?
Yeah, so as I just mentioned, of course, these are mainly public health related courses. So public health program is definitely involved, along with the environmental science, because we have that environmental health, and the bioinformatics, because the nutrigenetic course, involve a lot of public health, nutrition, along with the biology and bioinformatics. So the science are definitely on board, and you can see from the feedback of the student of these 3 courses that have been transformed, have been taught, and we have a lot of good positive feedback. So I think there's no question about the acceptability of this program with this kind of transform courses. In addition to that, we have advertised this to our social science colleagues. And as you can see, Naomi is already here, and she knows about it. She's going to follow up on this and try to implement some of this in her program, in the core program. And unfortunately, I didn't see Professor Moinul, and he's also aware of this. And I'm fairly confident that with the information that he has and the briefing that he had, he would be interested in also implementing this in his program as well. Now, that is within AEW. And as I mentioned in my last slide, is that, of course, that is a start, but we really want to expand to the whole country. And of course, we already have a couple of departmental head over here that are already taking initiative to implement that, and also going to further and introduce this to other colleagues in different programs. So I think, the response is definitely positive.
Mikhail, you're on
Thank you.
mute.
That's great. Yeah, thank you. That's great to hear that even in AUW, there has been this strong response to the work you've done. I think that'll end it for our panel session now. We want to start the concluding session now.
Aren't you meant to ask me, Mikhail? Or you forgot?
Oh,
I'm wearing two
sorry,
hats.
I did forget. Yes, I did
That's
forget.
all right. I'm wearing two hats.
Yeah,
very
you were supposed to
difficult when you go
co-moderate
from
with
moderating.
me.
I know.
My
It's all
mistake.
right. I thought I'd get off the hook, but that's all right. Yeah. Should I just respond very quickly? Yeah.
So
Yeah.
I guess now, yeah, it's the same question. How do you think there are practical ways for us to expand collaboration within the School of Public Health and BRAC University?
So just very quickly, I think, everyone gave an honest response. To me, as currently, as someone who's overseeing the school, that we've been doing experiential community-based learning from inception. We did the competency-based with you, Malavika Di and Tanvir, Dr. Tanvir, in 2016. We've been experimenting with this, right? Because of Erasmus, we managed to reform 3 courses. So it's been a huge learning process. And I do think that sometimes, in our case, the faculty are tied up between research grants and making time for teaching. And everyone teaches, but how much do you weigh up when we're a completely self-financed institution? Because you have to, I raise my own salary, so do all our colleagues and team members. And that's the reality. But education and our MPH program is our flagship program. It is the heart of what the School of Public Health is about. And without a decent program, we're not really doing due justice ethically to what we're kind of our job description. So of course, to kind of say that, yes, of course, we're interested. And I think it starts with low-hanging fruit. So first of all, doing outreach to within the school with some faculty who may be interested or excited by this kind of opportunity and say, I want to learn, without going on about incentives, because I don't have instant funding, or might be just interested because you want to learn. You want to just be a better teacher, or you excite them enough to say, okay, let me just experiment and try this. That's one. The other is reach out to already existing colleagues like, Professor Rabbani or Professor Mujibul Haq from the Associate Dean of Business School, because Professor Sangleen from Business School and I know Mujibul Haq are doing innovations in teaching. And they might be interested in looking at collaborating. For us, it's a win-win. For them, I think it's also win-win when you're looking at business skills with public health skills. Same thing working with, our Pro-Vice Chancellor now, Professor Nazia Yasmin, or Mullasa, who's already part of the partnership. So I think it's about step-by-step working with what I call low-hanging fruit, working with already existing colleagues where it's less demanding, because it's hard enough trying to convince people, then get people to give time, then get people to get ownership. So I would start with who already has ownership and is interested. Can we start there? And that would be my approach, because you already have built some trust, some rapport, some interested, like just Professor Deepak, who has been involved with the school for a long time and knows me well, and others at the school. It's much easier. And I think my philosophy, maybe, I don't know if it's my philosophy, maybe I heard it somewhere, but start small and then step by step, because I find that if we, I mean, I'm not against scale up. BRAC is a perfect example of scale up, but it's the step-by-step approach, I think, that eventually will kind of tell us what we need to learn, adapt, and refine. Because over the years, even with my teaching, I've had to adapt, refine, learn, and I'm constantly learning. I'm still learning. I still feel like a student, and there's many things I wish I'd done better. And the school, JPG, has a really fabulous sort of teaching model, but we also have a lot that we need to improve and learn. And I think it's important that we always say we need to learn more, we need to improve more. I think if we start with, we know it all, then I don't think there's any point in continuing. So I do think there's, and collaboration allows for that learning possibility, for that kind of growing as a teacher, as even as a mentor and being mentored. Thank you.
Thank you. Yeah, I think that there's such very valuable insights there. And the one thing that I hear most is that even though there has been a lot of talk about, you know, maybe faculty resistance, et cetera, but there are the faculty who are interested in this, and that's all we need to get started. And from what we've heard from NSU, from SUB, as well as from our partners, that we have enough interest to get started, more than enough. So let's get started on that step by step. We don't need everybody on board. We just need that the few, and we have that fortunately with us today.
And
already.
even within the school, like even within the school, there's a few faculty who are interested. So I think, yes, sorry, thank you.
Yeah, and that's exactly how we started with this project. So I think we just continue on building on that momentum. So I think that now officially ends the panel discussion. My apologies. So now we come towards the end of this and this symposium. So for the last 3 years and through COVID, mind you, it's been really exciting to watch our 3 partner universities undertake what many of us saw was an unprecedented level of passion, commitment, and collaboration together to redesign courses that have brought tangible, transformative student learning experiences and outcomes. Our partners have already been working through a kind of lab where they experimented, brainstormed, philosophized, soul searched, and then ultimately innovated a real robust repository of redesigned courses, faculty mentors, course and faculty learning guides, e-learning resources, and even faculty skills training modules. And a lot of this seems to have addressed a lot of the observations that came, that how do we continue local partnership or build on it? How do we get more systematic faculty development, a more systematic faculty teaching curriculum? How do we get started without money? And how do we structure it in a way that's meaningful for faculty? So now we're really excited as our 3 partner universities to announce that all these resources together in this kind of lab that we've been working in together is really the basis of us now launching officially the first of 3 health learning innovation labs in Bangladesh, which are going to institutionalize and expand faculty design and teaching capabilities, not only within our partner universities, but also serve as a platform by which and get started on collaborating with other universities now. So without further ado, I'd like to welcome our project coordinator, Ms. Tasin Hussain, and our project manager, Kabir, to give a very brief overview on these new health learning innovation labs. The floor is yours.
Please happen. Hi, everyone. Thank you for, no, it's not. Hi, everyone. Thank you so much for joining us here. Just to brief about the innovation, health learning innovation labs that Mikhail was talking about, I think what's core about these labs are that we'll be utilizing all the 30 faculty and facilitators who've been trained through this project. We spent 3 years working together collaboratively. You've heard a lot of a few of our trained faculty speak on this already. There are many more who are here in the who are in the panel, but I mean in the audience, but have not been in the panel itself. And together we formed a sort of peer mentoring network where the faculty not only receive training on how to facilitate their courses, but also how to facilitate training and encourage more of their colleagues and peers to join this sort of transformative revolution, as we've been calling it. This is sort of something that we've been working towards for these 2 years, and we're really excited to now be able to share it with everyone. And these faculty can come together to help anyone who's interested here in this panel, anyone who might be seeing this beyond, I mean, on Facebook or wherever, if you're watching this after the SESH symposium has ended, we can help you develop your own skills-based curriculum and train your faculty to teach more contextualized to your specific institution. Something that we focused on a lot in this specific project is contextualized learning and contextualized teaching. And so making sure that what you're teaching is contextualized to your particular institution is something that this lab is really looking to promote. And beyond this, the lab provides a space, and we're not just talking about a physical space, we're not talking about a virtual space, we're talking about this kind of like, it gives us the opportunity to come together and really share with each other. Because I think what Mola sir was saying is that we all sort of work together on this, right? We all collaborated, and Rabbani sir was sort of lamenting because he joined in year 2 and we were in the peak of COVID and really they had most limited interaction with one another. It gives us the opportunity to learn from each other because there's so much to learn. Me and Tasina, who will also be presenting shortly, we were there for all 3 years and we've really seen how learning, I mean, we got to see all 3 institutions and how they've transformed their courses, and it's really been really inspiring. And I think learning from each other is something that we're looking forward to. And so this lab hopes to promote skills-based curriculum, innovative teaching methodology, and faculty development. I'm going to pass this on to Tasina now to talk about the other resources we have available.
Thank you, Salima. It is good to see many of you here today. So as Salima was saying that, our faculties, they have worked with us for the past 3 years to develop a lot of documents. So over here, if we look at the screen, we actually had a total of 12 deliverables or documentations, which the teams have, the faculty and the course facilitators have developed through this Transform project in the last 3 years. These documents basically look at the course curriculum as well as the course syllabus, also the kind of learner guidance documents that we will have, as well as assessment forms, evaluation forms, not only for the faculties, but also evaluation forms for the courses, peer evaluation forms, which the students will use to evaluate each other. As well as, if you look at my screen, there is a faculty facilitator development manual as well, which details the whole process that the faculties actually went through to develop their designated course, or the course that they had redesigned through this process, as well as a teaching manual, which will be used as a guide for any other future faculty, who wants to redesign their own course within our respective institutions. So this lab will contain all these resources, and we are working on the lab. We are working on basically making all of these documents available to any of our within the institutions. That means in UW, JPG, and IUB. Other than that, as Mikhail was also saying that this is something that we want to kind of work forward. This whole process that we have learned in this last 3 years to the Transform project. This is something that we want to keep on building on it, and we want to share this knowledge with other higher education institutions as well in Bangladesh. So all of these resources will be shared outside of these 3 partner institutions as well, with the help of our trained faculties. They'll be guiding you, they'll be sharing their knowledge, as well as they will be giving you access to look at these documents so that, it's also a way for you to kind of look at it and help you develop your own respective course to make it more competency-based. So thank you, everyone. And other than that, in the screen, you can also see my email addresses there and also Salima's. Anyone who is interested to learn more about the project or, want to see any of these documents that, I had mentioned in our previous slides, you can just email us and, we would be more than happy to share it with you. Or we can also help you get in touch with Mikhail Bhai, who basically is the project design person. And, he will be able to answer a lot of your queries, as well as, help you get in touch with all our trained faculties from all 3 institutions. So thank you once again. It was really nice to hear everyone's presentation, and it has been a wonderful experience being part
There's
of
a big
this
blank in the middle. No?
Sorry, Papa. Thank you.
All right, that brings us to the end of this symposium. Ms. Sabina, are you there, or did we lose you? I think there might be connection problems. So thank you all for your participation and your involvement and all your contribution and hard work, and everybody who attended. As we said again, this is not the end, this is just the beginning, and that is the plan and design behind this project, is the next step of scaling up collaboration with all schools of public health in Bangladesh. There is, as Ms. Salima mentioned, a quiet revolution that we are all trying to undertake here. So we look forward to working together to transform not only our schools of public health, but also the health of our communities nationally in Bangladesh. So thank you all. It's been really an honor and privilege to have worked with all of you and for you to attend today. And thanks especially to our project managers, without whom none of this would have ever happened. So we look forward to hearing from you. We want to start our collaboration from today. So we hope to immediately get started with Dr. Deepak and Dr. Nazia starting next week. So we look forward to this collaboration starting right away. Thank you all, and we'll see you soon. Take care.
Thank you very much. Thank you. Sorry,
Thank
my
you.
internet dropped.
Thank
Thank
you.
you.
Thank you.
Thanks,
you.
everyone.
Bye-bye.
And thank you, Tasin and Salima and Adrita, for keeping it going.
You.
Thanks, Mikafa Design, and thanks to all the institutional focal heads. Appreciate it. Stay safe, stay well.
Bye-bye. Thank you.
Bye-bye.
Thank you. Bye-bye. Take care.
Bye-bye. Thank you.
And a big thank you to everyone in the audience who we couldn't invite onto the panels, but have been integral to the project itself.
Yes, thank you, audience. Nameless, faceless audience. Yeah. Thanks, Linda. Thanks, Anya. Thanks to the students.
Thank you, guys. That was pretty awesome. That was pretty awesome. 4 hours, and it went really, really well. Well done.
Yeah, I'm relieved.
Yeah, I'm not surprised. Yeah.
Yeah,
Well-
usually there needs to be a tea break, but it's worked out all right. Yeah,
Did,
the
I
real
thought it
work
was very
begins.
useful.
I assume there's still some more people in the audience listening.
Yes, yes, yes.
So well done. It's really good.
Thank you, Linda. Yeah, thank you.
4
all.
hours is a
Three and
long
half
time, but it worked. I snuck off at one point for a quick cup of coffee.
Did you?
Yeah, with my sound on, so I could still